narrower than it is in the PTH knockout. So PTH seems to regulate the formation of trabecular bone. PTHRP seems to be predominantly regulating the cartilaginous growth plate. So how can, just to summarize some of the other data that we have, PTH, as we said, has no effect on the cartilaginous growth plate. PTHRP will reduce chondrocyte proliferation, increase chondrocyte differentiation, and increase chondrocyte apoptosis in the growth plate. At the chondro-osseous junction, it will increase matrix mineralization and vascular invasion. And at trabecular bone, it seems, at least in fetal development, to, if anything, produce more osteoblasts and more trabecular bone in contrast to the PTH knockout. So how can this be? How can you have two molecules which both act through an amino-terminal domain that is homologous, causing such different effects in the fetus? And so there are some temporal considerations. Excuse me. So mesenchymal condensation to form the growth plate actually begins before parathyroid gland development. So there are no parathyroid glands at the time that the growth plate are developing or starts developing. So parathyroid hormone couldn't be the responsible agent. However, PTHRP is formed in the mesenchyme, and it does act as the endogenous ligand for the receptor. There are also spatial considerations. The cartilaginous growth plate is not vascular, it's avascular, and so PTH, even if it were present, couldn't reach the growth plate because it has to reach this through the bloodstream, and the growth plate is avascular. So it's a local PTHRP that is the active moiety. Then we said, is there evidence for a physiologic anabolic role for PTHRP in bone, which is unmasked by eliminating PTHRP? Which is, in other words, what is the phenotype produced by targeted ablation of the gene encoding PTHRP? And so what we did was a knockout, not a complete knockout, but these are heterozygous animals. They have one PTHRP gene, which is still expressed. And the reason we had to do this, we eliminated one gene only, was because the total knockouts do not survive much beyond fetal life, neonatal life, because they are short, they have all kinds of abnormalities. But the PTHRP heterozygotes do survive into adult life. We looked at them, and indeed they had less bone in the adult stage. This shows that the PTHRP heterozygous knockouts on the right have much less trabecular bone than the wild-type animals. We also looked at a conditional osteoblast-specific PTHRP knockout. We used a type 1 collagen promoter to specifically knock out PTHRP from mice. And when we did this, we all trabecular bone in the heterozygotes than there is in the control animals. So, what about the potential actions of PTHRP in vivo in bone? Well, the amino-terminal PTHRP may influence bone via post-receptor signaling pathways of the cell membrane, clearly. But there's also additional sequence, amino acid sequence beyond the amino-terminal domain that may have bioactivity. So remember that PTH and PTHRP are homologous at the amino-terminal end, and they bind to a common G protein linked receptor. They can activate a trimeric G protein. In the case of PTH, the major pathway is release of G alpha S, which will then stimulate the adenylate cyclase system, cyclic AMP protein kinase A. PTHRP can do this to some extent as well, but we also found that PTHRP, the homologous end, which binds to the type 1 PTHRP receptor, the same receptor, will activate the protein kinase C system. It'll cause release of G alpha Q, which will stimulate phospholipase C in the protein kinase C system and result in osteoblast differentiation. In addition, the protein kinase C will stimulate the expression of bone morphogenetic protein receptor, allow more bone morphogenetic protein to activate the cell, and this will, in a mesenchymal cell, it'll reduce adipocyte differentiation, and it'll stimulate osteoblast differentiation. So even though PTHRP acts as the same receptor as PTH, it doesn't use quite the same downstream signaling events. This is partly due to occupancy of the that's different between PTH and PTHRP of the receptor and other factors. Okay, now what about the possibility that there is additional biological activity beyond the amino-terminal domain? And so we know that there is in the 87 to 107 amino acid sequence of PTHRP, there is a nuclear localization signal. And so we asked, is it possible the nuclear localization signal was active in this molecule? And so we also found that PTHRP could localize to the nucleus. This is the upper panel shows ex vivo binding to the nuclei of primary osteoblasts, and the bottom panel shows binding to the nuclei of osteoblasts by immunogold labeling and electron microscopy. So what we did then was to create a knock-in, a PTHRP knock-in, in which we knocked in 1 to 84. So it was lacking the nuclear localization signal. And when we did this, we looked at the animals at 2 weeks of age. We found that the bone volume was down, the trabecular number was down, thickness was down, and the spacing was up. And we found that indeed they had less bone. I won't go into more detail. So PTHRP and BMI1 co-localize in the nuclei, and they co-immunoprecipitate. And so we came up with a scheme in which PTHRP, through its nuclear localization signal, can get into the nucleus. It can activate BMI1, and BMI1 will inhibit P16, P21. Now, P16, P21 is an inhibitor of cyclin D, which is a stimulator of retinoblastoma. And so if BMI1 inhibits the inhibitor, then cyclin D can activate retinoblastoma. You'll get cell cycle progression and self-renewal. Similarly, PTHRP will also inhibit P27. P27 is an inhibitor of cyclin E and CDK2 in this case. And if you inhibit the inhibitor, then cyclin E and CDK2 can activate retinoblastoma, and you'll get cell cycle progression and self-renewal. So it is possible that part of PTHRP's action is through the nucleus. It's a more distal part of the molecule. And this is because PTH mRNA can be produced, which will give you a molecule, a protein, which lacks a cell signaling sequence, whereas some of the transcripts may contain the amino acid, direct the amino acid sequence, which contains a signal sequence, allows PTHRP to get out of the cell, to bind to the cell surface receptor, and to activate in that manner. So there may be more than one role of activity, one mode of action of PTHRP. So if we summarize, PTH released by the parathyroid glands has to get to bone, where it will bind through an amino-terminal domain to the PTHR1 receptor. This is therefore an endocrine action. PTHRP, on the other hand, can act locally in a paracrine-autocrine manner, and it can act either on the type 1 receptor, or it can act through an intranuclear pathway, an intracrine pathway on cells, and this will lead to osteoblastic stromal cells becoming osteoblasts and then osteocytes. And PTHRP has also been utilized now as an anabolic for osteoporosis. This is an analog of PTHRP called abaloparatide, and this is approved for use in osteoporosis in April 2017. So both members of the family have found a therapeutic use in a very common clinical disease. So the studies have shown that PTH is a major physiologic regulator of bone formation. PTHRP, originally identified as a cancer hormone, is a major physiologic regulator of skeletal biology, including both cartilage and bone, and they may have shed new light on the mechanism of actions, and both have been approved as anabolic therapy in osteoporosis. What about vitamin D? Well, vitamin D, remember, undergoes a very intricate activation process. The precursor of vitamin D in skin is 7-dehydrocholesterol. This is upon irradiation by UV light, when the skin is exposed to UV light, UVB, then 7-dehydrocholesterol is converted via pre-vitamin D3 to vitamin D3 or cholecalciferol. Vitamin D3 can also be absorbed from the gut as vitamin D3 cholecalciferol or the plant-derived sterol vitamin D2. Vitamin D can then be hydroxylated in the liver. It's transported to the liver. It's hydroxylated at the 25 position to produce 25-hydroxy vitamin D. And 25-hydroxy D will then be transported to the kidney, where it will be 1-hydroxylated to produce 1,25-dihydroxy vitamin D, which is the active form. The 1-hydroxylase is also called CYP27B1. This is 25-hydroxy D is the most abundant circulating metabolite, and which we use clinically to measure the patient's status of vitamin D, but it is not the active form. It has to be converted to 125. 125 will then enhance calcium absorption from the gut and increase bone resorption. Now, there are a lot of other hydroxylations that I've put on this slide, but they're inactivating processes and not activating processes. Vitamin D is a corticosteroid. It will bind to the vitamin D receptor and then enter the nucleus, where it heterodimerizes with the retinoid X receptor, and there are a variety of co-regulators that will also bind to this complex, which binds to the vitamin D response element, and you'll get alteration of gene transcription. So we know that vitamin D is a skeletal catabolic because we said that an increase in 125D will occur when the calcium is low as a result of the PTH being stimulating and stimulating 125D. It acts on the early osteoblast to increase a cytokine called rank ligand and decrease a cytokine called OPG. This results in increased osteoclast activity, increased bone resorption, and a decrease in bone. It will also, 125D will also act on the mature osteoblast to increase local and systemic inhibitors of mineralization, and this will not allow calcium, therefore, to be deposited in bone, and will help to normalize the serum calcium as well, although in the extreme it can cause a disorder called osteomalacia. What about vitamin D as a potential skeletal anabolic? Well, let's look at results, indirect effects and direct effects. Well, we know from global knockouts we did global knockouts of the 1-hydroxylase enzyme, which makes active 125D. We made global knockout of the vitamin D receptor and of the combination. And when we look at what happens to the serum calcium in these animals, we find that even on a high calcium diet, the serum calcium is reduced in the 1-hydroxylase animals, shown in green, in the VDR, shown in pink, and in the double knockouts, shown in purple. You can put mice on what's called a rescue diet, which is giving them lactose in the diet, and the lactose will allow them to absorb more calcium and phosphorus, and they'll normalize even in the absence of 125D or of the vitamin D receptor. But if you leave them on the high calcium diet, you can also normalize their calcium by giving them exogenous 125D, as shown in the third set of bars. If you give 125D, however, they won't act on the animals that don't have a vitamin D receptor. Phosphorus is the same thing, and I won't go into that. And what happens to the mineralized bone? Well, on the high calcium diets where they're essentially deficient in calcium and phosphorus, there's a lot of osteoid, which is unmineralized bone. You put them on the rescue diet where they can absorb calcium and phosphorus. There's no unmineralized bone or osteoid. And if you give them 125D, you can also normalize the bone so that the osteoid is reduced. That's in the third panel group of bars. And the vitamin D receptor knockouts, of course, will not, these animals will not respond to 125D, and you will not be able to normalize the amount of calcium in the bone. So, mineralization of osteoid, the unmineralized part of bone, osteoid, it can occur in the absence of the 125 VDR system if the ambient serum calcium and the phosphorus are normalized. Therefore, a key part of the anabolic effect of vitamin D is indirect by its role on the gut to maintain normal calcium and phosphorus. So it has indirect effects, and it has direct effects, as I'll show you here. Here, what we did was to look at 4-month-old mice that had that had a 1-hydroxylase knockout or a VDR knockout or a combined knockout, and their osteoclasts are essentially unchanged, but their osteoblasts are very diminished. So you need 125D. You need it to be able to act in order to make osteoblasts. So endogenous 125 and the vitamin D receptor are required for optimal baseline bone formation. So here's a model of the anabolic effects of 125D on bone. It can act, first of all, if you look on the right-hand side, on the intestine to increase calcium and phosphorus absorption, increase mineralization of newly formed bone, and that is through its action on the gut, so it's indirect. But it can also act directly in bone by acting on the osteoblast to stimulate a potent growth factor system called the Wnt system, which uses LRP5 as a co-receptor. This will increase the bone formation rate. At the same time, the action on the osteoblast will decrease rank ligand relative to OPG, and this results in a decrease in osteoblasts, decrease in bone resorption. So it has, as an anabolic agent, and I should say this then results in increased trabecular and cortical bone. So it has both a direct effect on increasing bone and an indirect effect by providing mineral to make mineralized bone. So basal bone formation is dependent on normal levels of endogenous 125 in the VDR. We're not talking about elevated levels of 125. And exogenous 125 that normalizes a low 125 can also exert anabolic activity. Here again, we're talking about normalizing the low 125D. Now, in the last 2 or 3 slides, I'll just tell you a little bit about a rather intriguing possibility which has nothing to do with bone. And this is the fact that the 1-hydroxylase enzyme, which makes active 125 dihydroxy vitamin D, we know is made in the kidney. We know is present and expressed in the kidney. But it's also been detected in a whole variety of cells. And the vitamin D receptor has also been detected in many of these same cells. So what's going on? Well, it's been suggested that perhaps it has roles in immunomodulation, cell growth, bone health, et cetera, et cetera. So more recently, we looked at this with my colleague John White, and we looked at it and on what's its role in the thymic development. And we showed that there was skewed epithelial cell differentiation and premature aging of the thymus in the absence of vitamin D signaling. These were done in CYP27B1 knockouts or 1-hydroxylase knockouts. So these animals had a marked reduction in thymic cell number as they got older. So the knockout thymuses displayed accelerated involution and reduced expression of thymic longevity factors. So that in summary, the loss of thymic vitamin D signaling disrupted normal medullary thymic epithelial cell differentiation and function and accelerated thymic aging. And I'll show you one other non-bone mineral metabolism effect. We looked at possibility that has effects on aging. We know that 125D can stimulate the expression of NRF2, SIRT1, and BMI1. These can inhibit oxidative stress and DNA damage. And if you don't inhibit them, then you will get P16, P15, P21 expression. You'll get cell senescence and increase of senescence-associated secretory phenotype, and you'll get aging. So 125D, by stimulating those factors, which we've shown in experimental studies, can inhibit that. On the other hand, 125D can also inhibit KEAP1, and if KEAP1 isn't, it can inhibit KEAP1. KEAP1 will ordinarily stimulate these. I think the crosses in the wrong line. So 125D can stimulate and it can inhibit the inhibitor. And so you can get the activation of oncogenes, cell proliferation, and inhibition of aging and age-related diseases. I won't go into the effect on tumor cells. I'm just showing the effect on the normal cells. So I'll just summarize by saying PTH, PTHRP, and active vitamin D may be anabolic or catabolic in bone. The different actions may depend on developmental, contextual factors, dose. They may use different signaling pathways in carrying out these functions. Active vitamin D may have extraskeletal functions as well, and understanding these issues may help to utilize these factors clinically in relevant situations. And finally, I have to thank the individuals that I've worked with over many, many years, Shafat Rabbani, Dengshan Miao, my good friend and colleague, the brilliant scientist Dib Panda, Richard Kramer, Andy Karapoulos, who will talk next, Jeff Hendy, who unfortunately passed away several years ago, a much untimely death. And you can't do any research without students, postdocs, and fellows. I've been very blessed with having them from a number of different countries around the world, and I couldn't fit them all in because the screen is too small. And finally, I'll thank you for your attention.
Thank you, Dr. Goldsman, for such an illuminating lecture. And any questions? Yes.
Good morning, and that was a fascinating lecture. The details that you went into, crystal clear. I have out of your data question, since you have done such an extensive study on both PTP and vitamin D. I work in the area of mental health, and I would like to hear your thoughts, because we see a lot of either vitamin D deficiency or vitamin D binding protein deficiency in people with anxiety and depression. So would you have any insights on that?
That's actually a fascinating question. We have not explored that, and it's probably one of the very few areas that has not been explored. So if you want to take that on as a project, that would be a sensational project to look at. But I don't know of any data that's looked at that before. So there have been studies looking at neurological function, at multiple sclerosis and various other diseases. GWAS studies, for example, have implicated certain genes associated with multiple, certain genes, vitamin D-related genes associated with multiple sclerosis, et cetera. But I don't know of any that have looked at anxiety and depression. It's an interesting idea.
So we see deficiency in children with ADHD, attention deficit hyperactive disorder.
Oh,
And this is new and upcoming, and from our labs, it has just come out, the first paper.
oh,
So I was
wonderful,
wondering if there
wonderful.
was
Congratulations.
any-
I didn't know about that.
Yeah,
We'll have to discuss it later.
sure.
Thank you, Anuradha. Any other questions from the audience? Yes, please.
So, brilliant talk. And this might be a naive question, I don't know. So, I'm also Panda, Professor Pandey. So, given the official idea, the declaration that, HRT, the risks involved with estrogen-based HRT, is PTH therapy an alternative? Because most people are hesitant to go for estrogen-based therapy post-menopause. So is PTH therapy a good alternative, or one has to wait till osteoporosis begins?
Okay, it's an interesting question. If I can just repeat it, the question is, should we wait after the menopause, I guess, to start, when do we start treating with PTH as an anabolic? Is that basically?
Therapy. Is PTH a safer alternative to prevent osteoporosis?
Okay, so as you know, or maybe I assume you know, estrogen replacement therapy was the standard for many years, and then it totally lost credibility because of DVTs and cardiovascular effects, et cetera. And people have stayed away from estrogen replacement therapy, although low-dose therapy still works on bone, but most people are still afraid to use even that. Other studies came out saying if you use it within 5 years of the menopause, then if anything, it's very beneficial. You can then stop after 5 years and switch to something else. Now, in terms of using PTH, I think I would only start treatment based on some standard guidelines. There is something called FRAX, which is an algorithm which includes the use of bone mineral density tests and which includes clinical risk factors. It'll give you a calculation. It'll tell you what the 10-year risk of getting a fracture is. If it's greater than 20%, or if you have a risk of having a hip fracture greater than 3%, then I think that based on an algorithm such as that, I would start therapy. And there are also studies which have shown that starting with an anabolic therapy like parathyroid hormone is much more beneficial than starting with an anti-resorptive hormone therapy. And so it is a good choice if the patient needs it, and there are established criteria for when you should start the in fact, FRAX, you can Google FRAX and it'll come up and you can fill in the things. It used to be free. I think now maybe there's a charge for it. I'm not sure. We were involved in its conception, and we're updating it now in collaboration with many cohorts around the world.
Maybe one last question anyone has? I have a question for you. When you were showing the signaling pathway in PTH and PTHR2, are there microRNAs that are important in other metabolic diseases that are involved?
I'm sure there are. Yes, there are. MicroRNAs have been involved. I didn't have time to go into that, but 125D may regulate various microRNAs, for example. And so, but I almost certainly, yes. The answer is yes. They're involved.
Thank you very much. So I thank Dr. Goldsman again for such an illuminating lecture and very interesting work. And we thank him. And we say this is the end of the first session.
Thank you again.
Okay.
Thank you, Professor Goldman, and thank you, Madam. Please stay back on the stage. We will be asking Professor VC Sir and Professor Dean Madam to come on stage and felicitate Thank you, sir. Thank you, ma'am. Next, we will break for high tea, which is served on the other wing of this floor, and our volunteers will guide you for that. And please come back after 15 minutes. We will be starting the next session. Thank you.
So we shall proceed towards the next session. The chaired session is going to be chaired by our Dr. Anuradha Lohia ma'am. She is amongst us, and the plenary talk will be given by Professor Dr. Andrew Karaplis. Dr. Karaplis is not present here in person. He's joining us from Canada through Zoom. Now, let me introduce Dr. Anuradha Lohia. Presiding over this session as chair, we have with us esteemed Dr. Anuradha Lohia, former Vice Chancellor of Presidency University and a distinguished academician and researcher. Dr. Lohia is celebrated for her leadership in academia and her dedication to fostering research excellence. Her expertise spans multiple disciplines, and her guidance has been instrumental in nurturing intellectual growth and innovation. As a visionary leader and an advocate for scientific inquiry, Dr. Lohia brings a depth of knowledge and experience that will greatly enhance the depth of this session. Dr. Lohia was elected a Fellow of the Indian Academy of Sciences. She was also awarded these 3 Shakti Award and the UNESCO Molecular and Cell Biology Network Grant. It is truly an honor and privilege to have you with us, ma'am. I invite you on stage to chair the session.
To the audience, I just want to mention, in the morning we have a scientist and a cricketer. Now we have a scientist and a dancer. Anuradha is renowned for her classical dance. So she is actually a very talented classical dance.
Thank you. And as all classical dancers go through, I have finally achieved knee replacement. So don't worry, I don't dance anymore.
Thank you, ma'am. And joining us in Zoom, we have Professor Dr. Andrew Karaplis to give us his plenary talk.
So it's an honor and pleasure to be here at the SNU, which I have seen from next door, blossoming and growing exponentially in its academic excellence under the leadership of Professor Dhrubajyoti Chattopadhyay and his team, who have been very dedicated and hardworking to uphold his vision. I'm happy to see their students. I have seen so many of them under different circumstances, different fora, and indeed, Professor Chattopadhyay, I congratulate you on your achievement for bringing all these bright minds together. Today's session has already started off with a brilliant talk, which we just heard on the parathyroid hormone and the vitamin D, the connection between them. And I look forward to the next talk by our distinguished speaker, Dr. Karaplis. Both the speakers are from McGill University, Canada. And as far as I saw, Dr. Karaplis has done he's been at McGill University since 1992. Before that, he did a postdoc at MIT and a postdoc at the Whitehead Institute and at the MGH Cancer Center. So we look forward to hearing his talk today. And he's worked on the FGF23-mediated renal phosphate wasting disorders, renal cytogenesis, targeting vitamin D metabolism in osteoarthritis. As we all know, vitamin D is emerging as that master molecule which is not only controlling our cytoskeletal structure, it is controlling our immunity, it is controlling many other aspects which one never thought earlier that it played a role in. And now it seems that it is fast replacing other molecules which we thought were master regulators of the human physiology, and vitamin D has acquired a role of central importance. So I'd like to welcome you, Dr. Karaplis, if you have already joined us, to deliver your plenary talk.
Thank you very much, madam. Can you hear me? Can you hear me? Can you hear me? Can you hear me? I'm having trouble hearing you.
Dr. Karapallis, can you hear?
Yes, absolutely. Now I
Yes,
can
we
hear
can
you.
hear you.
Very good. Thank you very much, and good morning, everyone, or good afternoon, rather, everyone. Here in Montreal, it's almost 1 o'clock in the morning. I want to extend a special thank you to the President and members of the organizing committee for this very kind invitation. Regrettably, I cannot be there due to a visa complication that, despite the fact that we submitted the visa more than 2.5 months ago, nevertheless, I'm grateful that we can proceed with this session via Zoom. And despite the time difference, I'm willing to do so and happy to do so and enjoy the presentations that are ongoing. Today, I will be discussing the topic of renal phosphate wasting disorders. And this is a journey basically that exemplifies the integration of basic science, clinical applications,
Dr.
and
Karapallis?
translational research.
Sorry to
What
interrupt
we
you.
often call as physician scientists, what we call
Dr. Karapallis?
the path from bench.
Sorry to interrupt you. Can you please increase the volume a little bit? Please.
let me-
Yes.
That's at the maximum now. Can you hear
Okay,
me better
okay,
now?
okay. Please go ahead.
Thank you. So today I will be discussing the topic of renal phosphate wasting disorders. And as I said, this journey exemplifies the integration of basic science, clinical application, and translational research. What we often call the path from bench to bedside, and in turn from bedside back to the bench. I will let me. Okay, I'm sharing it. Are you okay? Can you see it? Hold on a sec. Sharing it is not really okay. Can you allow me to share, please?
You are already, you can share it, probably you have the access,
Yeah, it says sharing is not allowed for this
but
meeting.
we are not getting the display here.
Yeah, it says the host isn't allowing sharing for the meeting.
Like why we are not getting the display? He is also sharing. What he need to do? What he need to do? If there is any. Where is Sudipto? সেটাই হচ্ছে জিজ্ঞেস করতে চেয়েছিল তো
এখান তো মেক পোস্ট করে দিলে উনি ওখান থেকে সবই পারবেন।
কারণ এটা না একটা ট্রায়াল রান আগে দিয়ে নেওয়া উচিত।
আমি ওনাকে হোস্ট করে দিয়েছি।
Oh, now I can do it. Hold on a sec. Okay?
Yeah, Dr. Andrew,
Yes, very good.
you are now a co-host. You can, yeah, we can see.
All right, terrific. Thank you. So, okay. So, let me just put it up. And we're good. Okay. So,
Yeah, that's it.
Yeah, your slides are visible on screen here.
very good. Okay, thank you. So basically, these are my disclosures, and I will proceed here with my talk. It may be a surprise for a lot of you there, but it has become more and more evident that there is much more to bone than once was thought. Discoveries over the past few years have amassed evidence that, in fact, the skeleton behaves as an endocrine organ. We now recognize that bone cells, and these are namely the late osteoblast and the osteocytes. The osteocytes are the cells that are embedded into the bone matrix, are the source of a novel phosphaturic hormone, which we have named fibroblast growth factor 23, or in short, FGF23. FGF23 is a 227 amino acid protein. It is transcribed and translated as a single polypeptide and contains a cleavage site shown here in red. And cleavage of FGF23 by furin enzyme leads to its inactivation. So when it's cleaved by the enzyme and it's processed, it's inactivated. The process is tightly regulated post-translationally, shown here, and mutations affecting these processes have shown that they can alter FGF23 secretion. Now, once in the circulation, FGF23 travels to its target sites, where it interacts with its cognate receptor, which in this case tends to be FGF receptor 1. And upon binding, there's activation and signal transduction that brings about this altered gene expression related to its action. Now, this interaction has an absolute requirement for a co-receptor, shown here, named clotho. And this is a membrane-bound protein, which basically is required for FGF23 to activate FGF receptor 1. In the absence of clotho, this activation does not occur. While other FGF receptors, in this case, require heparin as their co-receptor, FGF receptor 1, in order to be activated by FGF23, has to have clotho present. Now, FGF23 acts primarily at the level of the kidney, and there are a number of effects that arise from its action. Now, shown here is the nephron, and the proximal tubule is here, the glomerulus is here. So basically, its site of action is the proximal tubule, where a lot of the reabsorption of phosphate from the glomerular filtrate takes place. And in order to take place, as it's filtered, as the urine is passing through and it's supposed to be filtered, the phosphate that is in the glomerular filtrate is captured by the sodium phosphate cotransporters, which are 2A and 2C. And these are bringing in the phosphate through intracellularly and putting it back into the circulation. Now, when FGF23, with respect to its binding to the receptor and clotho, activates the signal transduction process that, in conjunction with PTH acting at its own receptor, brings about these transporters into the cell, so they're not made available. And what happens is that when you have too much FGF23, you lose a lot of the phosphate into the urine. So you create what is known as phosphaturia, where basically you're peeing out a lot of the phosphate. The second level of regulation is at the level of vitamin D, and we have been talking about it extensively today with the talk by Dr. Goldsman. And in this situation, again, it's occurring in the proximal tubule of the kidney. What happens is that FGF23, through its actions again by clotho and its receptor, activates mechanisms that lead to inhibition of the 1-hydroxylase, which is the enzyme that converts 25 to 125, which is the active form of the hormone. And it also increases its, the activity of 24-hydroxylase enzyme, which is responsible for the catabolism. Therefore, the final outcome is basically decreasing the synthesis of 125 and increasing its breakdown, so leading to a low circulating level. Now, the fact that 125 is low in this situation has additional effects at the level of the intestine. And what happens here, vitamin D is important to activate another sodium phosphate, which is 2B. And this in this situation, when you have a low phosphate diet, you need this transporter to pick up the phosphate from the lumen of the intestine and transcellularly transport it across the cell into the circulation. And when your vitamin D is low, of course, that effect is decreased or eliminated, and therefore the ability to recapture this phosphate is diminished. So by its impact on what we saw in the kidney, and indirectly through 125 vitamin D action at the level of the intestine, the final outcome is basically a decrease in serum phosphate levels, a decrease in 125 levels, and of course the inappropriate loss of phosphate in the urine, because those transporters are missing at the intestinal, at the renal tubule epithelium. So with this sort of background, let's look at what diseases are associated with FGF23 action. There are a number of diseases that are shown here, and both inherited, shown on the left, as well as acquired, shown on the right. Now, the diseases that we know are known to have genetic causes are primarily the disease of XLH, or X-linked hypophosphatemic rickets, and we will be talking about this for most part of the talk. This is the most frequently inherited phosphate wasting disorder, and it arises from the loss of an endopeptidase named FAX, which resides on the plasma membrane of chondrocytes and osteoblasts. And unfortunately, up to date, we have very little understanding of how the loss of FAX leads to excess FGF23 secretion. So by losing FAX, there is an increase in FGF23 expression, secretion, and activity. There is an autosomal dominant form of the disease, which is rather rare, and it's caused by mutations at the cleavage site, which I showed you before, so that the cleavage site of FGF23 cannot be processed, and hence inactivation fails to take place, and hence you have more FGF23 in the circulation. There are autosomal recessive forms of hypophosphatemic rickets, and this is type 1 and type 2. The type 1 is caused by the absence of a protein called dentin matrix protein 1. This is a bone matrix protein, and we'll be talking a little bit about it in this presentation. And in the second form of the disease, of the disorder, this is caused by the absence of sort of an enzyme known as ENPP1, which is important for cleaving ATP to AMP and pyrophosphate, which is an important component to prevent ectopic calcification. There are a number of other diseases that I'm not going to go into, very rare conditions that are associated with increased FGF23 expression. Now, there are several acquired forms of increased FGF23 expression. The one disease that we will be talking about is called TIO, or tumor-induced osteomalacia. This arises from the ectopic secretion of FGF23 by tumors of mesenchymal origin. This is a paraneoplastic disorder that can be completely cured following resection of the tumor. Interestingly, and we have actually just published a case report in the British Medical Journal case reports of a patient receiving intravenous infusion of iron and developing severe hypophosphatemia to the point that she had to be admitted to the emergency room. And this has been known for a number of iron preparations, primarily by ferric carboxymaltose, but with the more recent forms of iron administration, intravenous administration, which is ferric derisomaltose or monoferric, this has not been known to happen, and therefore that was the reason for the publication. The major acquired disorder for FGF23 overexpression is chronic kidney disease. And this is a topic in its own, and I will not be addressing it in this presentation. So let's look at what happens in patients with XLH. What are these people look like, and what are their presentation, their clinical presentation? This also involves patients with autosomal recessive hypophosphatemic rickets, those primarily conditions that express high FGF23. So there are shown here is both the pediatric and the adult presentation. In the pediatric community, what one sees is very importantly the bowing of the legs, and this is due to rickets, where basically, the bone is not, the growth plates are not properly solidified, calcified, and the bones are not properly calcified, so therefore you get the bowing. But rickets is primarily the involvement of poor mineralization at the joints. There's this delayed and disproportionate growth, as you can see here. There is short stature, a very important issue that needs to be addressed in these patients. There is deformity, as we said, of the weight-bearing limbs. There is excess dental processes such as abscess and caries. There is osteomalacia as far as the bone is concerned, which basically means the bones are soft and therefore they cannot maintain the weight. We talked about joint pain, joint stiffness, muscle pain and weakness, gait abnormalities, and these are also present in the adult population. And in the adult, we also tend to see fractures, spontaneous fractures, including insufficiency fractures, basically arising from the poor mineralization. An interesting component of the adult is also the extraosseous calcification, that is, calcification that occurs outside of the skeleton, totally inappropriate, and affects a number of muscles, a number of enthesopathies, the enthesis, which is basically the connection between muscle and bone, and causing at times conditions such as spinal stenosis. So you can see that there's a wide variety of presentations that can occur with these patients. And of course, the underlying component is the overexpression and oversecretion of FGF23. So in the past 40 years, patients with these disorders have been treated with multiple daily doses of oral phosphate and active vitamin D. The goal, of course, of such therapy is basically to heal the rickets, improve growth in children, and to improve the osteomalacia that occurs in the adults, and to prevent fractures, of course. So despite this therapy, though, however, most patients have residual leg deformities. The short stature is not corrected for the most part. There is significant morbidity because of the arthritis, the chronic pain, stiffness, and decreased mobility. Additionally, patients find it very difficult to take these preparations of phosphate and vitamin D because of its frequent adverse effects that they have on the gastrointestinal system, such as diarrhea and bloatness, and of course vitamin D could, large dose of vitamin D could cause hypercalcemia and kidney stones. So in the last several years, the pharmaceutical companies have developed now and marketed an anti-FGF23 antibody, so an antibody that could bind and neutralize FGF23 in the circulation. And it is used in the treatment of these disorders. The flagship antibody is called burosumab, or Crysvita, and it has been approved for treatment in most common form, the XLH, in both adults as well as in children as young as 6 months of age. So there are several publications that have come out. I'm just going to show some of them. And more recently, the medication, the antibody against FGF23, has also been approved for tumor-induced osteomalacia. This is the condition where you have ectopic secretion of FGF23 by tumors. So very exciting and very important advancement in the treatment of these patients. So what I would do here is present you with a few cases. I will present you with one case of XLH, a patient with XLH. These are the patients that have the FX mutation. Two individuals, two brothers basically, that present with autosomal recessive hypophosphatemic rickets, type 1, where the mutation is in the dentin matrix protein 1, and a patient with tumor-induced osteomalacia. And these patients, of course, should have been treated or were treated with burosumab that basically inhibits FGF23 action and prevents all these changes that occur that we discussed about in the first part of this talk. So the first patient is a 38-year-old woman who presented several years ago to the medical wards with a 2-month history of worsening left thigh and hip pain, particularly when she was walking. She had poor skeletal growth since she was a child, and this resulted in a final adult height of 132 centimeters. On investigation, she was found to have a low serum phosphate, a low 125 vitamin D, an inappropriate degree of phosphate loss in the urine, given the fact that she had such a low serum level of phosphate. A similar growth pattern had afflicted her father and her 3 sisters, and when you put all this information together, she was diagnosed with X-linked hypophosphatemic rickets. This goes back several years ago, so we didn't know about FEX, or we're just beginning to know about FEX, which is basically the underlying cause of this disorder. Loss of FEX causes XLH. And at that point, she was only treated with 125 vitamin D and phosphate because burosumab was not available. So this is the picture of this individual with me standing there a few years ago. And you could see clearly the bowing of the legs, the short stature that is so indicative of this disease. And this is sort of representative of the fracture that she had sustained. This was a spontaneous fracture. And she had to undergo surgery because at that time, as I said, there was no burosumab available. And upon discharge, she was started back on phosphate and an active form of vitamin D in order to prevent this recurrence. So it's unfortunate that many years have since then have passed, and now we have something that is much more effective than the serum giving phosphate and vitamin D. But in that individual, we were not able to do so because of lack of availability. Regarding patients 2 and 3, these were two brothers that were referred to the metabolic bone disease clinic for what they referred to as abnormal skeletal growth. These individuals had short stature and severe knee deformities. They had poor skeletal development since childhood, requiring multiple surgical corrective attempts over the years. And they were the offspring of a consanguineous marriage, having one more brother that was afflicted by the disorder, but this brother was in Lebanon, so we never had the opportunity to actually examine him. So, as we said, the parents were actually first cousins. And of course, it speaks more of a autosomal recessive form of a disease. And these patients were treated unsuccessfully, to be said, with 125 vitamin D and phosphate. But as you could see, these patients had severe deformities that were arising because of the disease. Because of this type of presentation and this type of genetic mapping, we performed the typical biochemical analysis, and we saw that the phosphorus was low in both individuals. One more in the younger brother, it was more severe than in the older, and you'll see how that also presents clinically. The tubular reabsorption of phosphate, that's the ability to reabsorb the phosphate by the kidney, is diminished, greatly diminished. And 125 levels vitamin D were, although normal, they were totally inappropriate for the degree of hypophosphatemia that was seen there. So these patients, basically, we measured their FGF23 levels. In those days, we did it in the laboratory because this was no assay available at that time, and clinically. And we showed that both of these individuals had elevated levels. One had 110, the other 87, with normal being less than 71. So because of what we saw clinically, we suspected that these patients may have a mutation in the DMP1 gene. And indeed, when we did the DNA sequencing in both of the brothers, they had a single base pair substitution where basically the initiator methionine, shown here, was converted to a valine. So basically the initiator methionine that makes the protein was missing. So basically there was no protein made. These are controls from unaffected individuals. Now, the older brother presented with severe stiff cervical pain and difficulty walking. And when we actually did a CT scan of his cervical spine, we were totally surprised by the degree of extraskeletal calcification that this patient was presenting with, because this is the posterior longitudinal ligament that is found in the spine, and it is especially at the level of the cervical spine, it is totally calcified. As you could see, there is also syndesmophytes connecting the various vertebra, cervical vertebra shown here, which is totally abnormal. And when we did the MRI of this patient, and you look how this the development of this calcification of the posterior longitudinal ligament presses and develops a multi-level central canal stenosis at the cervical spine, explaining his symptomatology. This is very impressive. You could see how this is this signal here is lost in the cervical spine, and regained up, further up. This is sort of a longitudinal view of the serum levels from a number of biochemical parameters in this individual. But I just want to point out the phosphate. And you could see here are the normal limits in this box. These are the normal limits. And you can see that for many years that I was following this patient, he had a serum phosphorus that was always at the low level of normal. And then with the advent of burosumab, the administration of one shot, which is given every month, every 4 weeks actually, there was recovery of the serum phosphate level. And you can appreciate also here shown in the orange table that in fact how the vitamin D level also shot up in the presence of following burosumab treatment. So what has happened with this individual is that his pain still continues as far as the cervical spine is concerned. He has still difficulty in walking, but the good news is that he's not progressing in his condition, and he has regained a lot of muscle strength that was sort of impaired because of the hypophosphatemia. This is the second brother. He was actually more severely affected by the disease to the point that his muscles of mastication, you know, the muscles that we use to chew, were actually totally calcified. The radiologists had never seen anything like this before, to the point that he was unable to open his mouth to eat. And you could see here shown in this place is that he had to remove one of his teeth in order to allow a straw to be inserted and get his food through his liquid food through the straw in order to maintain his nutrition. He underwent one surgery prior to the time that I had seen him, which was not successful, trying to remove these calcifications that were occurring with regard to his muscles of mastication. But then he was started on burosumab, and he underwent a second surgery. And now you could see that he has the capacity to open his mouth a lot more. And it has been more than 5 years now, or probably around 4 years now, that he has been on burosumab. And this has not worsened. At least the condition has not worsened, and he's able to maintain this opening of his mouth in order to be able to eat. Interestingly also, during the time that we were following him, he developed leg pain in his thigh. And we did an x-ray, and you could see that he actually had developed what's known as a pseudofracture. This is because a pseudofracture is a fracture that arises in places where there is poor mineralization. And the treatment is, of course, surgical, but luckily for him, it was during the pandemic. And so we couldn't get access to surgeons at that time. And even more lucky for him, burosumab became available. So we started on treatment with burosumab, and you could see that following 5 months after treatment was initiated, that in fact the fracture had almost healed. There's still a little bit of a fracture line here, but you can see that it has big difference between what is shown here and what is shown here. So he was able to avoid surgery by the use of burosumab. So this is consistent with ongoing healing shown here on the right side. Again, these are longitudinal views of serum levels from this individual over the years. You could see that his serum phosphate, again, these are the normal range. He was always below and actually worse than his brother. And with the use of burosumab, he was able to actually normalize his serum phosphate. And of course, 125 also went up. Interestingly enough, we did publish these two individuals in in the Journal of Clinical Endocrinology and Metabolism a couple of years ago. And the reason that we were able to do so is because basically nobody has treated these patients ever, because there's so few of them with burosumab. So this was totally unique, and that's why the journal accepted to publish it. So finally, I want to discuss the final patient. This is an individual who was 32 years old, previously a healthy man. So this is an acquired form of FGF23 overexpression. So this man was working in the Cayman Islands on a bar at the Cayman Islands, a fantastic job, where he presented with 1 year history of progressive diffuse skeletal pain and difficulty walking due to muscle weakness. As far as his skeletal development is concerned, contrary to the other individuals, this guy had normal skeletal development and growth. Normal height, everything was normal. Nevertheless, his serum biochemical evaluation at the presentation in the clinic revealed that he had low serum phosphate, phosphaturia. He was losing phosphate in the urine, totally inappropriate given that he had a low serum phosphate. And of course, inappropriately normal 125 vitamin D, where basically it should have been high, much higher, even that phosphate was low. He was suspected of having tumor-induced osteomalacia. So this is, as we said, an acquired form of hypophosphatemic rickets. And we set out to find out where the tumor is. It's not always easy. And in the past, we didn't have very many ways of trying to identify where the tumors is, because sometimes they're in very weird places. And you know, we had to wait until perhaps the tumor was big enough to be picked up clinically. Here, what I've shown is the level of phosphate in this individual around the time of presentation, and you could see that the red indicates that he is severely hypophosphatemic. This is a panic low phosphate level at one point in time, but these are low levels of phosphate, while at the same time his urinary phosphorus level is perfectly normal. This is totally inappropriate given what's happening here. And alkaline phosphatase, which is basically the activity of alkaline phosphatase that we measure, is an indicator of the mineralization process that is taking place, or the attempt to mineralize. And of course, it's very high because there's very little mineralization that is taking place. So in order to identify where the tumor was, we performed sort of a PET scan. It's a gallium 68 dotadate scan. This is a scan that uses a radio tracer that is a somatostatin analog. And so basically, these tumors tend to have somatostatin receptors on them. So by using sort of analog that is tagged by radionuclide, we can identify, or at least try to localize, where the tumor is. And using this high affinity binding somatostatin receptor, which primarily recognizes the subtype 2 and less subtype 3 and 5 somatostatin receptors, we observed that there was an uptake and a sort of a strange uptake, abnormal uptake at the proximal tibia, shown here in higher magnification. So the patient was sent for surgery, and he underwent surgical resection of the tumor. I don't have the pictures to show you, but basically we did FGF23 expression in this tumor, and it was extremely stained with FGF23. The staining was very intense for FGF23 in the slides. So I have this thing to show you the remarkable recovery that occurs following this surgery, and he actually recovered with regard to phosphorus extremely well. You could see with how fast he basically normalized, and his activity of alkaline phosphatase normalized also following surgery. So we were very happy with the response, but unfortunately things don't always work the way we want them. And over a couple of years, we started noting that despite the fact that his phosphorus initially was very normal, it started decreasing over time, and we felt that maybe there was recurrence of the tumor. So we repeated the scan, and indeed we noted that there were several foci of tumor still remaining within near his proximal tibia. And when we tried to refer him to the surgery again, the surgeon refused to do it because he felt that if he goes after these small foci, he might actually be damaging sufficiently his tibialis anterior muscle that he won't be able to walk. So because of his age, he wasn't willing to do that. And we're looking now to use radiofrequency ablation to try and ablate these tumors. But nevertheless, in the meantime, while we're trying to get this underway, we started him on burosumab, trying to see if we can actually prevent this hypophosphatemia. And indeed, you could see that once burosumab was initiated, his serum phosphorus normalized. And this is his course over the years. You could see this is at presentation, this is after surgery, then the in-between period, and now on burosumab. So if I have to summarize, basically, all with regard to what burosumab does is that all studies reported show a significant improvement in the level of serum phosphate concentration, PTH, and serum calcium, and in the reabsorption of phosphate from the urine. Bone pain is frequently decreased because, as we saw, alkaline phosphatase activity normalized. There is a decrease in bone fractures and healing of pseudofractures, as we saw with one of the patients. There is reduction in the need for surgical intervention related to bone deformities. This is primarily in children, where my experience is minimal, because I'm an adult endocrinologist. And nevertheless, when you look at the pediatric population, the problem that primarily affects these individuals, the height, the gain of height has been very modest, if any. And the growth velocity of these children that are affected by these disorders has been rather meek. There has been very little improvement. And the question is why? Why are we still missing this beneficial effect when we know that we're correcting what we think is the problem, which is the serum phosphorus and vitamin D levels? Now, the literature has recently been annotated by a number of studies suggesting that endoplasmic reticulum stress and the integrated stress response that arises because of endoplasmic reticulum stress is involved in a number of pathologies, including type 1 diabetes, neurodegeneration, and vascular calcification, and more recently in chondrodysplasias. These are, of course, conditions such as this one that is characterized by faulty development of cartilage and growth of bone. So this process of ER stress and integrated stress response was interesting to the point that we in the lab, at the lab now, decided with the assistance of Dr. Dipiendo Tanda and Dr. Suyin Bai, who are the two senior people in the lab, to examine whether the growth plate chondrocytes experience ER stress in these conditions, and can we do something about it. Now, interestingly enough, there is a mouse model called the hip mouse that it's called hypophosphatemic. The hip is for hypophosphatemic. And it basically recapitulates all the manifestations of the human disease because it is also carrying an inactivating mutation at the FEX gene. So these mice physically and biochemically resemble the human disease. So we performed immunohistochemistry looking at slides from growth plate from both wild type as well as the hip mice. And we showed very convincingly that components of the integrated stress response, such as phosphorylation of EIF2 alpha, ATF4, and CHOP, were increased in the growth plate of the hip mice, but it was minimal, if so, in the wild-type mice. So, in fact, it appeared that the chondrocytes of the growth plate in these animals were experiencing ER stress and producing the integrated stress response. So then we asked the question whether we can actually prevent or alleviate a little bit of the chondrodysplasia in these mice by preventing the ER stress. And the way that we did that is we introduced TUDCA, which is basically toro-ursodeoxycholic acid, into their diet. TUDCA alleviates ER stress with minimal toxicity, and it can be administered orally, given in their chow. So we did that, and after 5 months of treatment, these are the results. These are wild-type mice. These are hip mice. You could see how short they are, their tail, how short they are from snout to tail. The length is very short. But when you treat them with TUDCA, only TUDCA, you can actually see that there is becoming more similar to the wild-type animals. The growth was also evident in the length of the femur, shown here. This is wild-type, hip, and those animals that were treated with TUDCA. And more strikingly were the improvement that was noticed in the growth plate of these animals compared to their counterparts that were not receiving the ER stress inhibitor. This is striking because this occurs in the absence of any changes in phosphate, calcium, or FGF23 levels. So this is totally independent of these parameters. So what we think, just to conclude my talk, is that HIP, and by extension we believe XLH, and we're ready to actually publish this data, is likely a primary chondrodysplasia, which is complicated by the presence of the existing FGF23 overexpression causing hypophosphatemia and vitamin D abnormalities. So it basically, this concept now is beginning to challenge the existing dogma that hypophosphatemia and altered vitamin D metabolism are the sole cause of the growth plate affliction in these conditions. And we feel that if we tune down the ER stress and the integrated stress response, this may serve as a primary or perhaps as an adjuvant along with burosumab therapeutic modality in combination, as I said, with current treatments. So I will stop here. I want to thank you for your attention, and I'll be happy to answer any questions. And I would like to acknowledge the two stars in our lab, Dr. Dipien Dupanda and Dr. Suyin Bai, and of course my longtime collaborator, Dr. David Goldsman, who presented earlier. So thank you very much, and I'll be happy to answer any questions. Thank you. Well, this is how we did it with the animals, basically administering TUDCA. And TUDCA is a very safe drug. It's actually ursodeoxycholic acid, which is a cousin of the drug, is already in use for biliary sclerosis, to prevent biliary sclerosis. So it's an FDA approved drug that could be given. And more importantly, it is also presently used in patients with ALS. This sort of gave us the incentive to push it forward in the clinical setting and hoping that we eventually could try to use that. And we're trying to, with collaborating with the pharmaceuticals, try to use both the combination of burosumab and at the same time decrease the ER stress using TUDCA in the patients so that we can see if there's any improvement in their height. The problem is that the height is still lacking when you use the antibody. Thank you. Thank you. Thank you. Thank you. Thank you very much. Thank you. Thank you.
Hello. Now we will proceed towards felicitating Dr. Anuradha Lohia ma'am, and on behalf of Dr. Professor Andrew Karaplis, sir's colleague will receive the felicitation here. May I call on stage Dr. Anuradha Lohia ma'am, and to felicitate, may I call on stage our Honorable Vice Chancellor, sir. Yeah, hi, I'm here.
Just a moment. There will be an announcement. Just a moment, he's there.
I'm this to you. I'm bringing this to you and I'm carrying this audio here.
Thank you very much, and I don't know how to express my thanks for your hospitality and your kind invitation. Thank you. I wish next time I could make it there.
And he sent me when I'm coming back to lab.
Next time. Thank you. Thank you.
Thank you, sir, and thank you, ma'am. Now we proceed towards our next set of invited talks, and to chair this session, we have amongst us Dr. Professor Kaustav Panda and Dr. Chon. Dr. Panda is currently working as a professor and the head of the Department of Biotechnology at the B.C. Guha Center for Genetic Engineering and Biotechnology, University of Calcutta. Dr. Panda is internationally renowned for his research in disease biology, physiology of nitric oxide, and xenobiology. His current projects are elucidating the role of nitrosative stress in asthma, developing as in vivo probe for monitoring inflammation and mitigating oxidative damage during arsenic poisoning. Dr. Kaustav Panda has many awards and honors to his credit. He has been an elected fellow of the West Bengal Academy of Science and Technology. He's also the recipient of the UGC UK IERI Thematic Partnership Award. He is a recipient of the Kurana Technology Transfer Award. He's a recipient of the Innovator Award in 2006 from the Cleveland Clinic Foundation, US. He has been also awarded the Gordon Research Conference Best Young Investigator Award at the Gordon Research Conference in Italy. He's the recipient of the Research Star Award from the Cleveland Clinic Foundation, US, amongst many others. He has more than 50 journal publications and book chapters, and he also holds a patent in a novel probe for longitudinal imaging of inducible nitric oxide synthase in live cells and animals. Our next chair for the day is Professor Chandrima Das. Professor Das is from the Division of Biophysics and Structural Genomics Division of the Saha Institute of Nuclear Physics. Professor Das is interested in the epigenetic regulation of chromatin structure. Her lab, Chromatin Dynamics Lab, focuses on characterizing the critical interactions between histone, post-translational modifications, and readers, which regulate important cellular pathways and their dysfunction, leading to diseases, including metabolic as well as infectious diseases. Professor Das's lab employs a combination of approaches, including conventional biochemistry, biophysics, molecular and cellular biology, as well as high-throughput sequencing techniques to address these questions. Dr. Das has many awards and accolades, again, to her credit. She has been the recipient of the CDRI Award for Excellence in Drug Research in Life Science category. She has received the S. Ramachandran Award in National Bioscience for Career Development. She has received the Swarna Jayanti Fellowship from the Department of Science and Technology. She has received the Ramalinga Swami Fellowship from the Department of Biotechnology. She's also the member of various learned societies, like the Fellow of the National Academy of Sciences, Fellow of the West Bengal Academy of Science and Technology, amongst many others. She has over more than 80 journal publications to her credit. I request on stage Professor Das and Professor Panda to chair the session. They're already here. And for the invited speakers, we have Dr. Benubroto Das, Dr. Partho Chakraborty, Dr. Sangram Bagh, and Dr. Gitanjali Sundar. Over to you, sir, ma'am.
Hello, good afternoon, everyone. It's a real honor and pleasure to be here, and I thank Professor Bhujyoti Chattopadhyay for this gracious occasion. And without further ado, I will proceed in introducing the first speaker, Dr. Benubroto Das from Indian Association for the Cultivation of Science. He is a fantastic scientist and has been working on a very competitive field of DNA repair, the influence of DNA topoisomerases, and recently he's into mitochondrial DNA repair mechanisms. He's a postdoctoral fellow from the National Cancer Institute, NIH, and he has numerous awards and accolades, to begin with the Wellcome Trust DBT India Alliance Intermediate Fellowship. He has published a lot of seminal findings in a number of prestigious journals, and he's a great scientist, and he's recently received this Academy Awards, and it's a real honor and pleasure to introduce him in this great meeting, and I would request him to come up on the stage and give his talk. Thank you.
So first of all, I want to thank the organizers for this invitation. And I also want to thank Chandrima for the illustrious introduction. Thank you very much. So today I'm going to talk about some of the very recent findings that we have in the lab. Right. So where is the point? I'm audible, right? Yeah. So I belong to this, the oldest institution in this country Indian Association for Cultivation and Science. This is a historic institution because this institution has generated the only Nobel Prize in Science in this country, Sir C.V. Raman. So my lab in this institute is primarily focused on understanding different aspects of DNA damage and repair. We are topoisomerase-centric lab, so primarily we are involved in understanding the DNA topology, the structure, the function, the regulations, and the dynamics of DNA topoisomerase inside the cells. So primarily our focus is not only to understand the mechanism of action of topoisomerase, but the drugs that are used in the clinics for the treatment of different cancers, primarily the topoisomerase inhibitors, how they change the topology of the DNA as well as the landscape of post-translational regulations. So we try to understand the mechanism of repair and the different types of post-translational regulations inside the cells. Recently, we have started working on a mitochondria because mitochondria plays a very important role, is the powerhouse of the cell. So we try to understand how mitochondrial DNA damage and accumulation of mitochondrial DNA damage actually contributes to different types of human diseases. And finally, as a molecular biologist, we take all the advantage of staying in cultivation of science, which is a more chemistry-based institute, to collaborate with the chemists to find new novel molecules that targets topoisomerase to inhibit topoisomerase and have a potential anti-cancer activity. So we try to discover new targeted molecules against topoisomerase. And finally, we are working on PARP inhibitors for many years. So we made the seminal contribution in understanding the PARP trapping, which actually appears to be one of the key mechanism of, as a monotherapy, how the PARP inhibitors can inhibit or cure breast cancer and ovarian cancer who are deficient for BRCA mutations. Now for today's talk, primarily I'll be talking about a recent work that we have published and are based on some of the post-translational modifications that we look inside the cells. Now to set the stage, basically, whenever you have a process of local unwinding of the DNA, like replication, transcription, or chromatin remodeling, you actually make a lot of supercoils in the DNA. And these are positive supercoils which are ahead of these processes, and you have negative supercoils behind these processes. So these are the true topological barriers. So the pointer is not working. So these are the two topological barriers. Yeah, I tried that. Yeah. Anyway, not a problem. So these are two topological barriers that actually doesn't allow this machinery to go forward. And there are dedicated proteins inside the cells which are known as topoisomerase. They actually binds with the supercoiled DNA and changes the topology and relaxes the DNA. So basically, how the topoisomerase functions, the topoisomerase functions in a very interesting way. It binds with the DNA, then makes the DNA in a covalent complex. It remains on the DNA and then it swivels around the DNA. So by the attribute of this rotational motion, it actually unwind all the supercoils and then it religate the DNA. So this is biphasic reaction. One is the cleavage and another is the religation, as you can see here. However, in the presence of the specific inhibitors, which are known to be in the clinics, like topotecan, irinotecan, or camptothecin, they binds in the interface of the topo-1 cleavage complexes, as you can see here with the yellow box. Actually, they trap these complexes. And now think about a situation, you have a complete traffic jam, because all the highway, you have all the traffic jams due to the stopping of the cars. Exactly that is the situation. If you think of the genomic landscape, topoisomer is getting trapped on the different parts of the genome. Now the condition is that if something happens, there is a heavy collisions happens due to the replication or transcription machinery, you end up with all the double-strand breaks. And we have seen like 50 double-strand breaks are good enough to kill a cell. So repair of this trapped topo-1 cleavage complex is an essential need for DNA metabolism. And as you can see here, the normal cells have multiple repair pathways. Like here you can see that, you have a, sure. Sorry about this. Yeah. Okay. So as you can see here, there are multiple repair pathways. Like you have a homologous recombination, you have the alternative pathways, which is the non-homologous adjoining pathways, and which includes the endonucleases that takes a chunk of the DNA from here, and it cleaves the DNA from there actually. So maybe I can use the pointer, that is better actually. Yeah. There, that's good enough. Yeah, thank you. So exactly, yeah. So this is the endonuclease pathway which takes up a chunk of DNA with the trap topo 1 cleavage complexes, and there are the dedicated pathway which is the TDP1 repair pathway. So TDP1 is an enzyme which is primarily involved in taking away the topo 1 from the DNA and basically generates a phosphate in the 3' end of the DNA. Now, TDP1 functions in a complex with multiple proteins, which includes PNKP, polymerase beta, and ligase 3. So TDP1 generates a phosphate, then is a part of the base excitation repair, where the next protein is the PNKP, which generates a hydroxyl group in the 3' end of the DNA. And finally, the polymerase beta do the gap filling, which is finally sealed by ligase 3. But whenever we have pulled down this complex, we find multiple protein in the complexes. And one of the protein that we have identified in the complex is PARP1, PRD5, and many others. Now coming to the function of TDP1, TDP1 is very interesting for the post-mitotic cells, particularly the neuronal cells. Because if you have a point mutation in TDP1, the single point mutation can end up with a cerebellar dystrophy, which is known as a neurodegenerative disease, which is known as spinocerebellar ataxia with axonal neuropathy type 1. And you can see here 200-fold atrophy in the cerebellar cortex. So what we have shown that this protein interestingly binds with the mitochondrial DNA, or get trapped on the mitochondrial DNA as a secondary lesions. And these lesions is actually responsible for the neuronal death. But we have found an alternative pathway by which these lesions could be rescued by the process called mitophagy. But today I'm not going to talk about this one. I will primarily focusing on the post-translational regulations of the protein. Now TDP1 is a very important protein inside the cells. So hence, like P53, there are multiple post-translational modifications that actually regulate the function of TDP1. And you can see here, it goes to the parylation, ubiquitination, phosphorylation, sumolation, arginine methylation, which was discovered from my lab, and deubiquitinations. So what we have shown that arginine methylation, which is a very upcoming emerging field, methylation of the arginine residues can regulate TDP1 functions. For today's talk, we get more intrigued to the additional post-translational modifications that happens outside the interface boundary. Because we were more intrigued to understand how TDP1 is regulated during the mitosis. So what we did a post, after the generation of a flat TDP1 construct, we pulled down the construct under independent conditions with damage, without damage. We put it in the mass spectrometry, and there we identified a site of phosphorylation, which is at serine 61 of TDP1. Now this is interesting because this is in the N-terminal of the protein, and this N-terminal is very distorted. So that doesn't have a specific function, but we get intrigued about these phosphorylations. Now when we carefully looked into the phosphorylation site, we find it matches with the consensus phosphorylation of CDK1, which is a proline-directed phosphorylation sites. So this led us to investigate whether CDK1 interacts with TDP1. Indeed, in the pull-down experiment, when we pull down flat TDP1, we can pull down actually CDK1, and these interactions was independent of the catalytic activity of CDK1. So we have used CDK1 inhibitors, it still interacts with TDP1. We have done here the reverse immunoprecipitation experiments, where we pull down against CDK1, and under that condition, we can pull down TDP1 in the complex. So suggesting this is a novel interaction between the two proteins, which is TDP1 is the DNA repair protein, and CDK1, one of the temporal kinase that regulates the mitotic phase of the cells, are interacting together, and we discovered this particularly through the mass spectrometry. Now the obvious question was that, how to identify this phosphorylation? To identify this phosphorylation, we have generated a phosphospecific antibody against this particular phosphorylation serine 61 site. And as this particular phosphorylation is happening during the mitosis, so we have to synchronize the cells with nocodazole. And you can see here, the nocodazole can only pick up a single band with a similar molecular weight with TDP1, suggesting TDP1 is phosphorylated during mitosis. And if we mutated this site, we completely abrogate this phosphorylation, suggesting this is the primary sites of phosphorylation. Now to test or investigate the temporal kinetics of this phosphorylation, what we did, we synchronized the cells with nocodazole, and we can see here the phosphorylation peaks immediately after the G2M, and then with the telophase it goes down, suggesting this is the event which is happening during mitosis. And these are the different markers which actually confirms that indeed the cells are in the mitotic phase. Then the question was, since CDK1 is interacting with TDP1 and CDK1 consensus site of phosphorylation is actually identified, so the question was whether CDK1 is involved in this phosphorylation. Actually, to test this possibility, what we first did, we synchronized the cells, then we knocked down the CDP1, and we used a specific antibody for the TDP1 phosphorylation at serine 61. You can see here, and you will appreciate, when we knock down CDK1, we abrogate this phosphorylation, suggesting that primarily inside the cells, CDK1 is involved in enzymatic phosphorylation of TDP1. Now, the next obvious question was to test whether it can in vitro phosphorylate TDP1. To actually test that, we have used the recombinant proteins, which is wild-type TDP1 and the mutant TDP1. In the presence of CDK1 and the cold ATP, we can show that TDP1 is indeed phosphorylated by CDK1, and this phosphorylation was abrogated when you muted the site of phosphorylation. Now, the obvious question was to test the biological significance of this phosphorylation. So the first thing we did was to actually look into the temporal kinetics of this phosphorylation. To do that, we did immunohistochemistry with the phosphospecific antibody. Now this we have to do in the mitotic phase as well as in the interphase. And to test, we have used different types of inhibitors, the topo-1 inhibitors that traps topoisomerase as well as acetylcholine that actually inhibits the replications. Now to our surprise, a protein which was discovered by Howard Nash from NIH, which is involved in the repair of the trapped topo-1 DNA complexes, or different types of DNA breaks that happens in the DNA, are now no more on the DNA. So this was too much surprise to us. We find TDP1 was completely outside the condensed chromatin. Now we looked into the literature. Indeed, we can find the canonical DNA repair proteins are actually outside the condensed chromatin during the mitosis. So to test further, we see when we stain the cells with TDP1 specific antibody, all this condensed chromatin was totally devoid, consistent with the phosphospecific staining. And here, when we put CDK1 inhibitor that phosphorylates TDP1 at serine 61, we find TDP1 was readily detected on the condensed chromatin. Now this was interesting. Only changing the synthetic function of the CDK1, we can actually bring back TDP1 on the condensed chromatin. Now the question was this functional TDP1? Whether this is involved in the repair activity or not. So indeed we have actually tested the cell fractionation, the chromatin fractionations, and we can detect TDP1 back on the chromatin when we abrogate those phosphorylations. And this was also further tested in the presence of the ectopic wild type and the serine 61A mutant. You can see here the serine 61B mutant, unlike the wild type TDP1, was back on the condensed chromatin. So whether this is back or they are trapped. To test that, we have done the chip experiments. So you know there are some fragile sites in the chromosomes which are often attributed to the breaks due to the late replication stresses. And interestingly, they can percolate through the G2M boundary with these breaks to the mitotic phase. So these fragile sites of the chromosomes could be actually repaired locally in the mitotic chromosomes. So we want to test whether TDP1 is actually getting trapped on these fragile sites. To test that, we look into the endogenous TDP1 and topo1. Yes, indeed topo1, there are many nature papers which suggest in these fragile sites, during the replication and transcription, the topo1, the local unwinding of the DNA is attributed to topoisomerase 1. And consistent with the literature, we detected topo1 was actually enriched in these particular fragile sites. And these are breaks. So these breaks were actually detected by an antibody that actually detects the breaks, which is gamma H2X. We find there is a marked increase in the gamma H2X in these particular fragile sites, but not TDP1. But situation completely changes when we transfect the TDP1 knockout cells with a 61A mutant TDP1, which was not actually not phosphorylable. So you can see here, there is a marked increase in the trapping of TDP1 in these fragile sites. Now, what is the effect of this trapping of TDP1 on these fragile sites of the chromosomes? So we find breaks in the mitotic condensed chromatin. So these breaks are actually colored with gamma H2X, which is a particular antibody that detects phosphorylated gamma H2X, which is at the site of DNA double strand breaks. And you can see here, these breaks get increased when you express 61A mutant TDP1. And here is the more details of quantifications. We carefully looked into these breaks. We can see here there were chromosomal bridges, there were micronuclei which have these breaks, suggesting if you express the phosphorylation defective TDP1 inside the cells, you end up with chromosomal catastrophe. So these are the signs of genomic instability. Next, what we did, we want to test whether this breaks comes from more trapping of topoisomerase 1, because topo1 is already known to be in the breaks. But what to our surprise, we find there is no further increased trapping of topo1, but the breaks are more, maybe it is attributed from other sources. The breaks are generated by other molecule. To test that, actually this is a very recent novel development which is known as in the science, which is the mitotic DNA replications or mitotic DNA repair synthesis. So the condensed chromatin, unlike the interface chromosomes, they are refractory to the local DNA repair mechanisms or synthesis mechanisms. So there are local hubs in this condensed chromatin. It's kind of a patch filling. Suppose when you're going through the road, you have some gaddas, right? You have the holes, and these holes are filled. Exactly these situations happens in the condensed chromatin. So this is known as MIDAS, which is mitotic DNA synthesis, where the polymerase T is being involved for the synthesis. And indeed, we can see the BRDO incorporations in the condensed chromatin, suggesting that when you trap topo1 with the mitotic DNA breaks, you actually start making DNA synthesis. And this DNA synthesis is further attributed to the increase of the gamma H2X, which could be abrogated by acetylcholine, suggesting this is actually a replication-associated DNA synthesis. Now, since TDP1 downstream protein is required to complete the BER, base excitation repair, we don't find any of these partners of TDP1 in the pathway, which may attribute the reason why TDP1 is kicked away from the condensed chromatin during the synthesis. And there is an entirely different repair pathway, which is the endonuclease pathway, which is the MUS81 mediated pathway, which get involved in the condensed chromatin to repair the trapped topo1 cleavage complex. So this is a discovery we made, that the canonical DNA repair protein in the mitotic phase are not involved in the repair of the trapped complexes, but there is an entirely different sets of endonucleases which gets involved in the repair of the trapped detrimental complexes. And exactly, we find that MUS81 is the endonuclease which gets recruited at the sites of these breaks in the condensed chromatin. And when we knock down MUS81, we completely abrogate these breaks, suggesting these breaks are coming from MUS81. But we find an overloading of MUS81 when we express serine 61, suggesting it is not only involved in taking away the trapped topo1 cleavage complexes in the condensed chromatin, but also involved in taking away the trapped complexes of TDP1, which is defective in phosphorylation. So this is more details of the quantification. This suggests that TDP1, MUS81 is actually enriched in these complexes. And we can also show that the enrichment of MUS81 during the chip assays, there is an overloading of MUS81, and that can be attributed to the increased amount of breaks that we see in the condensed chromatin. And finally, if you have more breaks in the condensed chromatin, you end up with these mitotic catastrophes that you can see here, the micronuclei, the anaphase bridges, the chromatin breaks, the cohesion defects, together is totally a catastrophe that leads to the abnormalities in the cells. And finally, when we knock down MUS81, we can rescue the phenotype to a bit, suggesting a novel role of MUS81 in actually cleaving the breaks that are associated with the trapped topo1 and TDP1 complexes. So finally, so this is the model which we come up,
And we show that TDP1 is phosphorylated, and this phosphorylation actually follows the phosphorylation pattern of CDK1. And CDK1 is involved in phosphorylating TDP1. So if you phosphorylate TDP1 at Sedin61, you actually end up with a proper mitosis. There is no 53BP1 foci. There is no sign of chromosomal disintegrations. But if you abrogate the site of phosphorylation, then you actually trap not only topo1, but also TDP1 in these complexes. You have hyperactivation of mitotic DNA synthesis. You actually make anaphase bridges, micronuclei, and an induction of a lot of MUS81 in these complexes, which makes a lot of breaks, and which are the signs of genomic instability. And most importantly, I should tell, this is the only student who is the first author and the only author of this paper who has done this entire piece of work, which is published in EMBO Journal. Currently, she is working one of the big shot, David Cortege, who is the discoverer of the DNA repair pathway and the mitotic DNA synthesis. So thank you very much. So everything happens when you have a good pool of students, and I'm fortunate over the years. These are my forces, the energy, the activation sources, and these are the people who are key to all this beautiful data that I show in all meetings. Thank you very much, and these are my funding agencies, and thank you very much. I will take questions.
Since we are almost 1 hour late, the rule we will go by is if the speaker crosses the time limit allowed, there will be no questions, but you are welcome to interact with the speakers during the lunch hour and ask questions if you have. So since we have crossed the time limit, but during lunch hour, we hope people will come and
sure.
If anyone asks questions. So this, thank you so much.
Thank you.
After this, we have Dr. Partho Chakraborty from CSR IICB. So among the physician scientists who are working in India, Dr. Chakraborty certainly, scores out among one of the most brilliant scientists that are working in the country right now. He's presently senior principal scientist as CSR Indian Institute of Chemical Biology, Kolkata. He completed his MBBS from Calcutta Medical College and MD in biochemistry from Banaras Hindu University, after which he did his, after his MD, he went on to Boston University Medical School to complete his PhD. He joined CSR IICB in 2011 and established the Metabolic Disease Laboratory out there. Dr. Chakraborty has numerous high-impact publications to his credit and several illustrious awards. And his research interests are on pathogenesis of diabetes, obesity, and fatty liver disease. With that, we welcome Dr. Chakraborty to deliver his talk. What is the topic?
Yeah, right. Yeah, so this is right. Yeah, fine. And this is the thing. Okay, okay, fine. Okay, so thank you very much, Professor Panda, and for the introduction, which was a bit elaborate, what I deserve. So this talk is just before lunch, and in our lab we study nutrition and metabolism. So maybe it's worth in contextualizing what I will be talking about. And so as you said, the topic of this talk is about steatotic liver disease, which was formerly known as fatty liver disease. And fatty liver, as you know, it's a very common term, and whoever goes to a USG radiologist, and you will find a grade 1, grade 2, and stuff like that. So we conducted a study in Kolkata and across India, and we have found that more than 30% of adult Indians are having fatty liver disease. Now that's not the problem. Problem is not accumulation of fat. The problem is whether these accumulation of fat actually leads to development of actual pathology, what we call a stage called MASH. Okay, so the progression matters. So this is what is now termed as metabolism dysfunction associated steatotic liver disease, muzzled. Okay, and so steatotic liver, when it goes to a stage called MASH, is SH stands for steatohepatitis. That means it's a condition of sterile inflammation and fibrosis, a repair mechanism which is ubiquitous for all our tissues. And if this fibrosis progresses to cirrhosis, this is a terminal stage when either liver transplantation or death, these are the only two outcome a patient can have. Okay, so the point is, this progression is about almost like 15 to 20% rule. So whatever the fatty liver disease patients or individuals, at least 15% will develop NASH, and out of them 15% will develop cirrhosis at the end of the day. So that's the progression, the pathway. And if you look at the global statistics, where we did not include our data because we are still processing the data, but you can see in India at different parts of the country, it's already mentioned that it's more than 30 to 40% of the adults. Okay, we are carrying that. And India, in the global map, you see it's pink in color. So at least in this context, we are at par with the Western countries and US. May not be in other aspects, but at least in the context of fatty liver disease, we have reached them. So that's what it is. Now, this is the reality. But in lab, what we do, we study pathophysiology. Okay, so we try to understand what are the molecular or genetic players which are involved in the pathogenesis of these diseases. And as you can see here, so these diseases, like any metabolic disease that includes hypercholesterolemia, atherosclerosis, or type 2 diabetes, these are multifactorial disease and involves a lot of factors. And one particular factor, one or two factors may become very important in one individual, not all of them, right? It's kind of buffet. So you have multiple factors, few factors becomes important, okay? And of them, you can see there are question of diet and lifestyle. We all talk about it. There are definitely genetic underpinnings are there. There's issues with dysbiosis or changes in the gut microbiota repertoire. There is metabolic flexibility, the issues with metabolic flexibility or inflexibility. And there are epigenetic factors, as Shangram was mentioning to me. Again, these patients in Indian context, they can be obese, they can be really fat people, and there can be lean patients, okay? So very interestingly, in Indian context, we don't get really obese of, like 120 kilo, 130 kilo like in the West. Even we find like an individual with 55, 60 kilogram of weight having significant liver fat and fibrosis, okay? Which is very unique to our country, and we need to understand the pathology of these situations. And some of them becomes really rapid, slow progressor, and there are some rapid progressor, and there is no FDA-approved drugs specifically targeting fatty liver diseases available in the market. Only recently, this drug has come up, thyroid hormone receptor beta selective agonist, but the therapeutic window is really, really small, and it is, again, it's not available in India at this point. So, so this is the scenario. So for the treatments are concerned, so we are, again, as I mentioned to you, that we are interested in the pathophysiology of this disease. And as you can understand, as we have talked about, the steatosis, okay? Steatosis means the accumulation of fat, okay? So whatever is happening in liver is in the background of the fatty liver disease, okay? And just accumulation of fat, as I already mentioned to you, it's not that disastrous. It's become problematic when it is associated with mitochondrial dysfunction oxidative stress, ER stress, and inflammation, and there are cell death. There is associated systemic insulin resistance and fibrosis, definitely. Okay. As you see in the title, it says NASH. It's not MASH. NASH is the older term, non-alcoholic steatohepatitis. Now it's called MASH. So we got a biopsy sample of one individual who was weighing like 80 kilogram of weight. So this liver biopsy, as you can see, this classical accumulation of fat in the low magnification, right? These white dots are basically the lipid droplets within the hepatocytes, and these are the magnified view. And you can also appreciate there are a lot of fibrotic strands here and there. So this is a classic human liver biopsy looks like. Okay, this patient is from Sonarpur. Okay. Now, so in the lab, we started asking, as I have already mentioned to you, there are multifactorial disease, and there are a lot of pathological facets which basically articulate with each other for a clinical manifestation of the disease. So we'll be looking at few of these factors. We study a whole bunch of them, but for this talk, I'll be talking about only two aspects. One is steatosis, and another is proteostasis, which is something we have made some contribution in the field. So this is the picture of a steatosis, as I've told you. And from a biochemical standpoint, accumulation of fat is simply a disbalance of triacylglycerol synthesis and catabolism, right? So the classic lipogenesis, lipolysis, where lipogenesis stands for fat production, and lipolysis is a dissolving the fat. Okay. So we asked a very simple question: can we dissolve the fat? Then the problem is solved, at least in the cells, at least in the animals, right? We're not talking about humans at this context. So we thought about dissolving it first, and we looked at lipolysis pathway, and we targeted a protein called ATGL, adipose triglyceride lipase. This is a rate-limiting enzyme of this lipolytic pathway, the first enzyme involved here, okay, which produces diglyceride and single free fatty acids. So we thought, let's look at ATGL and how it behaves in liver. And with a lot of deliberation, what we found that these ATGL actually targeted by one E3 ubiquitin ligase that decorates ATGL with a polyubiquitin chain and targets it to the proteasome and degrades it. Okay? So COP1 actually kills ATGL in liver, and these are some of the data to suggest that when you knock down COP1, you can, so this is the ubiquitin pattern, ubiquitination, polyubiquitination pattern of this protein, ATGL. It is lost. ATGL interacts with COP1 in a very specific site called valine-proline residues, VP motif. So when we mutated this, you can see the ubiquitination is also abrogated. Next, we looked at whether this is actually relevant in the animal context. So what we did, we took the animals and put them on a biryani diet. Okay, we call it high-fat diet. And these animals become really fat, and they accumulate a lot of fat in the liver. Okay. So in this fat liver, what we did, we knocked down COP1. Because COP1 is a bad guy, we want to save ATGL. So this is the knockdown in the liver. And if you look at the liver histology again, but this is mouse liver, please remember. So this is the normal liver. When you feed them with high-fat diet, you can see it's become really pale, accumulated a lot of fat. When you knock down COP1, the fat is dissolved. Okay. So that tells you this is a proof of concept that if you target a ubiquitin ligase, that can help in reduction of liver fat. Okay. So this is an interesting finding, and we thought, so this is a genetic evidence and biochemical evidence. We thought whether we can produce some chemical evidence. Okay. So when we looked at the structure of COP1 a little bit closely, and its interaction with ATGL peptide, part of ATGL, we could see there are two pockets here, right? Two cavities. So we collaborated with our very talented medicinal chemist, Dr. Arindam Talukdar in our institute, and we discussed that whether he can make some molecules which could actually fit into those pockets. Okay, so we have 2 cavities. So his team basically prepared like more than 150 compounds. We tested them, and after all this, work for a couple of years, we could come up with one molecule. See here, this is what is called quinazoline didione-based derivative of this scaffold. And this particular molecule is orally bioavailable. It's pretty stable in mouse plasma, and it can be given orally without any toxicity. So, okay. So we did a whole bunch of biochemical assay to suggest that, yes, it works in cells. And we, again, feed the mouse with biryani diet or high-fat diet. You can see here they accumulate a lot of fat. When we gavaged our molecule for a month, you can see most of the fats are gone, right? So we actually recapitulated what we have found genetically. Now we could show the similar phenotype by chemical modification. So this is a wonderful thing. As Benu was talking about, collaborating with chemists, we also had that advantage in our institute, and we could do it. And we have published it, and it was in the cover page of JMC. Now, another aspect. So this is, we talked about steatosis. Now we talk about another aspects of this pathology called proteostasis. So since liver is a metabolic hub, whenever we study metabolism, we talk about basically liver metabolism, okay? So it metabolizes lipid, protein, fat, but in addition, this is a hub of protein synthesis, because as you know, 90% of the plasma protein comes from liver, okay? So there is a high rate of protein turnover in liver, and what proteostasis means, the homeostasis of protein metabolism, that involves protein synthesis, folding, misfolding, and its clearance either through ubiquitin pathway, ubiquitin proteasome pathway, or through autophagy lysosomal pathway, right? So, so there are some clinical studies. One of them is shown here, where they have shown in human fatty liver disease, there is accumulation of, this is immunohistochemistry of ubiquitin. So ubiquitinated proteins gets accumulated in the liver, okay? So that tells you that in fatty liver disease, there is, in addition to fat, there are issues with protein metabolism. So we look back to the literature of different clinical studies and case reports. Even in last 100 years, even before having a good microscope, pathologists used to see the slides and used to draw it by their hand. And one of those examples you can see here, in a chronic liver disease, the pathologist actually drew all these liver cells, and they drew these pink bodies within the cells. They used to call it hyaline bodies in those days. So there are descriptions of protein accumulation in liver for last 100 years, and actually nobody has really looked at it in details in the context of pathophysiology of MASLD. So as you can see here, so this is proteasome, right? So these are the 2 central units, beta and alpha. They are responsible for proteolysis. There are regulatory particle, 19S particle, and now there are drugs and molecules which could inhibit proteasome, okay? And one of them are very important, bortezomib, carfilzomib. These drugs are clinically used in the context of multiple myeloma, which is a cancer of plasma cells or beta cells, B cells, which produces a lot of antibodies. So it's a protein-producing factory, and bortezomib is used there. So and we have seen case reports that bortezomib therapy leads to liver failure, hepatitis, and death. Okay? So liver toxicity is one of the side effects. So we thought that yes, proteasomal dysfunction could be associated with all this liver disease. So we took this challenge, and we embarked on this journey to see whether protein metabolism is important. So what we did, we first took the liver biopsy samples from healthy patients and NASH patients, and we did a proteomic study, transcriptomic study, and what we could see, you could see here, this is the healthy group in a PCA plot, and the NASH group, there are two different NASH groups. So the NASH are not heterogeneous, at least human NASH, at least in India, at least in Kolkata area, okay? And what we could see, that one group has a significant issues with protein metabolism and proteasomal function, okay? So a subset of NASH at least have this issue, okay? Next again.
Doctor, sorry to interrupt you. 2 minutes. If you can wrap up, you will get questions.
3 minutes?
That's the
Can you
intent.
spare me 3 minutes? Okay.
Thanks.
Okay. So, so now again, if you look at again our mouse data, we put them high-fat diet, and you could see the proteasomal activity was significantly down in this mouse liver. That tells you if you feed them with high fat, you have issues with proteasome, right? And to cut a long story short, as Professor Panda indicated already, we could found that proteotoxin leads to huge ROS production, reactive oxygen species, and that leads to very specific response, okay? So one is there is an aberrant activation of a kinase called ASK1 that leads to cell death, and we also have found there is an impairment of NRF2 PPAR gamma network, so the dampening of antioxidant response, right? So it's a dual sword, already ASK1 is activated and NRF2 PPAR gamma axis is down. So, and there is a ASK1 inhibitor was in the clinical trial, it's called selonsertib, and PPAR gamma activators are already available as an anti-diabetic drug. So what we thought, let's see whether these, if we combine these two drugs, whether it can give some beneficial effect. So we gave the mice with a lethal dose of bortezomib. You could see by 36 hours, all the animals died. When we used this combination of selonsertib and pioglitazone, which is a PPAR gamma agonist, at least 50% animals survived, were alive till 72 hours. So it directly gives you that this combination has a superb hepatoprotective activity in the context of proteasomal inhibition. Also, just to add that if we use all these, the dual therapy in animals, you could reduce fibrosis, ubiquitination, oxidative stress, and cell death. Okay, so these are different assays done on the liver tissue. Again, then we went to Arindam Talukdar and we asked, can we make a molecule combining these two? Okay, so we have some excellent data. Again, so we discussed, and what he came up with a chimeric molecule, half ASK1 inhibitor, half PPAR gamma activator. Okay, it's a very unique chimeric molecule. We tested it, as you can see here. These are the red signals are for oxidative stress, cell ROS. Selonsertib has no effect. And CHS, this is the PPAR gamma agonist. It has effect on ROS, but no effect on cell death. Cell death is the green one, okay. When you combine these two compounds, you see the chimera has wonderful effect in terms of reversing both, okay. Both reduction of ROS and prevention of cellular injury. Again, by medicinal chemistry tweak, he made it bioavailable, orally bioavailable. We fed the mice with these compounds. So we have started getting the data very recently, where we could show that this is the ubiquitin stain. You can see when we treat the animals with bortezomib, there is an increase in ubiquitin stain. Our compound significantly reduced it, significantly reduced clipped caspase-3, suggesting that these compounds could be very important, this chimera, in the context of proteotoxicity. So these are the medicinal chemistry approach. From a biological standpoint, we thought how we can approach this, but by tweaking the biology of it. So what is the break? So these are the chemical break, but what is the biological break? Biological breaks are nothing but deubiquitinases. So when you block proteasome, there will be accumulation of ubiquitinated proteins. There must be some deubiquitinases which could reverse this phenomena. Okay, so this is the DUBs where they remove the ubiquitin chains from the substrate. Okay, so we set up a siRNA screen for all the human deubiquitinases, 96 of them, and we could identify a very specific deubiquitinase called JOS-D1, okay, and which could reverse the proteotoxicity from the siRNA screen. So these are some of the biological validation. This is a live dead cell assay. You could see there is, when you add MG132, a proteasomal inhibitor, there is dead cells. When you overexpress JOS-D1, it is significantly reduced. Similarly, when you overexpress JOS-D1 in mouse liver using an adenoviral delivery system, you could reduce oxidative stress, you could reduce cell death. This is the CC3. When you knock down JOS-D1 in mouse liver, the cell death was increased. Okay, one bortezomib treatment. That tells you it is biologically relevant. And again, to cut the long story short, we showed that upon proteotoxic stress, JOS-D1 actually moves to plasma membrane where it gets monoubiquitinated, forms a submembranous network where it actually works through deubiquitinating SOX1, and SOX1 actually are the most important player for the hepatoprotective action. So I think I did not exceed the time. So these are the main people, Devajyoti and Soheli. They drove the projects. Now Abhishek and Sujoy has taken up the project from my lab. Our long-term clinical collaborator is Dr. Abhijit Chaudhary, and medicinal chemistry division with Arindam Talukdar and his team. And these are the super chemists who actually helped us to chemically validate whatever the biological findings we could get. Thank you very much.
Thank you so much, Chaudhary. Again, Dr. Chakraborty will have to also take question. I wish all the speakers a very peaceful lunch today. So all of you are crossing this anyhow. So we'll have, if you have any questions, please approach Dr. Chakraborty and also Professor Das after they have finished their lunch, or they've begun with their lunch maybe.
Sure.
Don't interrupt them with their lunch. So with that, we'll have, thank you so much. A nice talk. Next speaker.
We have the next speaker, Professor Shangram Bagh from the Biophysics Structural Genomics Division of Shaha Institute of Nuclear Physics. So he has done his postdoctoral research from Massachusetts Institute of Technology, and he has joined Shaha Institute of Nuclear Physics from 2014, and he is a prolific scientist working on synthetic biology, and the field of the research is a very upcoming and budding field. He has numerous awards and accolades in his bag. So to name a few, he's a fellow of Royal Society of Chemistry, and his work has been featured in MIT Technology Reviews. He has got invited talks from India EMBO Symposium and several other places. And without getting into further kind of detailed list of the awards, which is really numerous in this context, I would now request Professor Shangram Bagh to deliver his lecture.
Thank you very much for the invitation and this privilege to be here, to the organizing committee, especially Siddhartha. And so at the very beginning, when Professor Saha actually mentioned that we are in the today, and actually go signaling pathway and try to read the poetry of the life. But I try to convince you at this moment, we are probably entering an era where we can also start to write the poem too. So if you are a Netflix addict like me, probably you have seen there is a science fiction animation series there, and it's called The Love, Death, and Robot. And in this particular series, there is one story, and this is called When the Uyghur Took Over. So this story is about this, the scientists who are working on the lactobacillus, that is the bacteria you find in the yogurt, and accidentally they developed a super intelligent lactobacillus. And that super intelligent lactobacillus now started controlling the human and took over the whole world from the human. And at the end, they developed their own space technology and diverted Earth. So this is science fiction. And what we have to do with this science fiction story to our lab. So one of the questions we're trying to answer in our lab, can you make a bacteria which can be an artificially intelligent? So artificial intelligence is a buzzword now, and if you look at whatever the artificial intelligence today, and they are based on artificial neural network. And it's 90% of the artificial intelligence is based on the artificial neural network. And that concept is definitely coming from the how neuron actually works. That's actually the basics. So if you take a neuron and give some of the input, a chemical or electrical in terms of X1 and X2, and then you want to get some of the output in terms of the Y1 and Y2, the neuron, whatever the neuron is, it always follow a same kind of mathematics. Now what do? Forget about the neuron, you draw a circle on a board and just take that mathematics onto that board, and it will look like something here. So if you see, there's a X1 and X2, if this is the input, then first what will happen, they will sum it up linearly in a weighted fashion. What does that mean? If the weight for the X1 is the W1 and the weight for the X2 is the W2, then it is the X1 W1 plus X2 W2 and so on. And then it will go through a threshold or nonlinear function and it will give an output. Okay, now what we'll do, you take a board and draw so many circles and connect all of them just following this mathematics. What you'll get, it is called the artificial neural network. It looks simple, but it can do an amazing things, right? So for example, you have taken many photographs today, and if you take a group photograph and actually upload in the Facebook or Instagram, and then the Facebook will ask you, do you want to tag yourselves or your friends? So how Facebook does know that it is you and that's your friend? That's because the Facebook has the face recognition algorithm in their server, and it is nothing but an artificial neural network. So what it is does, so when from your photographs, it is just taking your pixel values, that is the input, X1 and X2, you can see here, and then it do the mathematics and get some Y1 and Y2. What this Y1 and Y2 is going to tell you? It is going to tell you nothing. So what the Facebook will do now? Now this artificial neural network, they will start changing the W values. And at a certain combination of the W values, your output is going to match with the photographs you have already uploaded on the Facebook and identified it as yourself. So the question my lab asked, can you engineer the bacteria in such a way they will work as an artificial neuron, which basically means it will follow the same kind of the mathematics in terms of this input and output. And now in a culture, if this all bacteria comes together and they form the artificial neural network, if it can be done, then we can actually do so a lot of different kind of the computation. And I'm just happy to tell you that we have able to develop the first artificial neural network with a genetically engineered cell, and this came as a two cover page into two journals. But that is, I'm not going to cover that today. But what I just want to mention that after those papers, so there is something called communication of the ACM. ACM is the Association of the Computing Machinery. That is the organization which gives the Turing Award, which is popularly known as the Nobel Prize for the computer science. So it is completely a computing society. They made a story. And in this story, half of the story, they actually talked about our work in a very detailed analysis of our last two works. And in the conclusion, they tried to mention something. They mentioned that biological computer could outperform silicon-based computer. So this is a very happy moment for us because as a biologist or a biotechnologist, we believe that is our hypothesis. And then suddenly a proper computing and most respected computer organization is actually giving a seal on that this is possibly possible. And that reminds us, or at least remind me, so this is another science fiction series, and this is Star Trek. This is one of the newest series of the Star Trek. It is called Star Trek Discovery. And in this Star Trek Discovery, they have the spaceship, which is USS Discovery, and their mother computer is not made by the silicon. They're made by biological organism, and that is made by a fungus. So you can see the mycelial network. So that mycelial network computer can do all quantum physics calculations, all the navigations, and so on. So definitely that's a science fiction. So if I rephrase our question in a very bigger way, so I could ask that can real science back this idea up? Okay? So now, if you look at the history of the synthetic biology, so here, when people started, so the time point people starts from the 2000 generally, and when people started to think about that if you take some of the protein and genes and make some of the biochemical reaction, which will work as some of the logic gates, then what you can do, you can connect those biological logic gates together, and you make some of the signaling, some molecular pathways, which will give exactly the kind of the behavior you want. And people actually try to show, I mean, from the last 25 years, they developed a lot of different logic gates, they connect them, and they made some of the device property like the half adder or the analog to digital converter and so on. But so that is good. But the question we asked that if you really want to make a bacteria as a computer, if a real computer, then you have to ask such a question with to answer which requires computer. For example, if you give a number and ask if it is a prime number, if you give a letter and if you ask if it is a vowel, and you can do this kind of mathematical questions. So this cannot be done on a calculator. So you need a computer and you need to write a program to actually solve that. So when you have to write this program and then you can solve that, the computer program can actually solve it, print your answer, yes, no, or any other terms. So our question is, can you make the bacteria computer which can answer those kind of the questions? So very first thing, if you want to do that, first you have to find out how we are going to communicate with the bacteria, how we are going to give the problem, how we are going to tell that to the bacteria. So if a computer, if you see when you're writing a C program or a Python program, you're writing in English. But what is happening at the machine level? This is coming down to the 1 and 0 in the binary, and that binary is given by the either there is a flow of electricity or there is a no flow of electricity, right? So the similar approach you have taken. So now, if you have the decimal number 0 to 9, for each of the decimal number, they have some binary counterparts. For example, if you come to the 7, the 7 is 0, 1, 1, 1. So, and each of the position is called the bit position. Now we assigned 4 different chemicals for 4 different bit position. So means if you want to ask the bacteria or a culture that if the 7 is the prime number, what you have to do, you have to actually add the IPTG, ATC, and AHL, the 3 chemicals, forget about what are they, and then, but you don't add the error. Means when you're adding, that is 1. If you're not adding, that is basically the 0. This way, you can actually ask this question. And then, now bacteria have to tell us if it is how the bacteria is going to communicate with us. So, in this case, if it is a number is a prime number, then bacteria will print that, yes, by glowing green. Means it is going to produce a green fluorescence protein. If the answer is the no, it is going to print no by glowing red by producing a red fluorescence protein. So this way we can actually communicate with the bacteria. So now you have this problem and the solution kind of the structure ready. So how the bacteria is going to process that information? So for that, as I said, that we developed an artificial neural network. We developed all the rules that how from this kind of the problem and solution statement, what could be the architecture of the artificial neural network that is going to happen. And here you see that is, so now this is, you see here is completely mathematics, but you change this X1 to your concentration of either of those chemicals, your output is the fluorescence proteins, and here, whatever the nodes are there, it is just the bacteria. But this bacteria has to follow exactly that mathematics. Now I want to take, because there's a lot of students here, I just want to mention the one, and most of them are probably a biology student. I just want to mention this mathematics has not been done by any physics or engineering student. They have been all done by my biology students. So it is very easy to learn because there's no, there should not be any barrier that you cannot learn. This is very easy and people actually did that in our lab. So that is our goal. So I'm not going to the details, but when you have this mathematics, we developed how that mathematics is to translate it in the molecular principles. For example, here you see it is just a node and there are so many W values here. So if the W is positive, then it has to activate the genes. If it is the negative, then it repress the genes. If it is 0, it's invariant. And when all these things meet together, then your bacteria fires, means start producing protein. So what we developed an artificially gene regulatory network, several genes and proteins. At the same time, what are the promoters? That's all synthetic promoters. We developed the synthetic promoters in such a way, various transcription factors actually come together and some activate, some depress, and so many. Some actually stops the RNA polymerase and so on, so on. So and then you have to get this kind of the curve on the mathematics. And then what we do the experiment, and in experiment we just try to fit it to that if it is the experiment is giving the correct result. And at the first time, what will happen? Exactly like the Facebook, nothing will happen. You won't get your desired result. And then you start changing various parameters so that your actual mathematical parameter falls within the range. So how we are doing that? We are changing the DNA-protein interaction, protein-protein interaction, translation, transcription rates. We are changing many, many things. And then we, at this moment, we know how to tune those parameters in that way. So, and when, so we have we have 14 different cells here, I just showed 9. And okay, forget about this. But these are the 9 different artificial genetic regulatory network. We put in the 9 different cells. Now, when it is done, everything optimized, you take those cells, mix together, and then start doing the experiments. And here, see, the question is that if the n is the prime number, and you can see here in the case of the 2, 3, 7, and 5, you can see this is all green. They're green, and when this is the other numbers, which is not a prime number, they're just is the red. Similarly, we have done it's for the vowels. So here is the, so you take the letters, go to its decimal, and from this decimal to go to the again binary. That is the artificial neural network for that. And here you can actually see for the A, E, and I, the bacteria are growing red, saying these are the vowels. And in other cases, they're growing green to say this and no. So now we have done several other problems. I'm not going to details, but now we just try to scale it up. Scale it up means at this moment it was giving a single question's answer. Now it would like to give 2 questions together. So the 2 questions is if n factorial is divisible by n multiplied by n plus 1 by 2. And the second question if n plus 3 is a prime number or not. And if you actually go to the results, you can see they're giving actually the correct results. We scale it up a little more, and now it is the 3 questions they're answering. We're just increasing the number of fluorescence protein on the outside, on the answer scale, and you can see the number of, this network can actually give answer to these 3 questions if n squared be represented as a sum of 3 factorials, if n squared is an interprime, and if n is a Ramanujan prime. Okay, so what are the problems I try to show here? Those problems are called computational decision problem because it is giving a decision, yes and no. But what if you really want the correct answer, a real answer? So one of the problem, it's called optimization problem. So you're a very good students. If I give you a pizza and pie and ask you just cut it on the 4 straight cuts, so and give the pieces to the other people. So you'll cut the 4 and you get the 8 pieces and you'll actually distribute to others. But if you're a backbencher like me, you'll cut in a different way. So the same 4 cuts, but I'll make here as maximum number of pieces because the backbencher like to share. Okay, so but here the 3 pieces are bigger, so I'll take the biggest one. Okay, and then I'll give one to the Partho, he's my childhood friend. Okay, and okay, I don't know, cost of that. Okay, I'll give the third, and the rest of I'll give. But the question is, even my good intention to give all of you this piece, I cannot give because with the 4 cards, I can maximum number of cards I can do only 11. I cannot do 17 or 20 or 100, right? So there is a very interesting mathematical problem. It is called the lazy Carteret sequence. It suggests that whenever a disk or a pizza or something, if you cut out a certain number, how many maximum pieces you can get? So that same thing we actually asked to the bacteria. And here, the answer has to be not in the yes or no, actual number. So again, for the answer, here we put 4 different beat positions and and give 4 different, assigned 4 different fluorescence proteins. So that if the answer is for 4 cut, the answer is 11, right? So which means 1, 0, 1, 1. What you can see here, fluorescence protein is expressing. It is black. This fluorescence protein is expressing. Here is the fluorescence protein expressing. Similarly, for the 0 to 4, the other numbers are giving there. So very simply to tell what we have tried to do here, we want to see this as a Lego-like system. We have engineered 14 different cells with 4 different artificial genetically neural network. And these 14 cells is like a Lego block. In a Lego block, you can take some of them and make a house, and then change a little bit of them, and it would make a car. If change a little bit of them, it is going to give a road, right? So similarly, from these 14 cells, we can think about some modular Lego block. You mix them and you start giving the answer to various different questions, and we're able to develop for these 14 cells the 12 problems. We're able to solve the 12 problems. So when it is published in a few months back, what we're very interested that now we found that it is taken by the world community is very, very excitingly. We found that, some of the very important reputed science journals like the New Scientist and the Physics Worlds, they featured our work. At the same time, it has been featured in the various different languages and various countries. It is starting from the Italian to Spanish, to the French, to the Polish, and so on. So we are very, very happy that whatever we have done from this city with the same students like you, and this is now, it's, I mean, all world is actually somehow, they are very interested in this work. So that is a very it boosts our morale. So the whole question is, who cares? Why you want bacteria to identify the prime number? So the first motivation is that, so if you think about a computer, this is the world's smallest computer at this moment, and this is made by the IBM. You can see it is the smallest computer and it is the centimeter level, though it doesn't have the battery yet. So if you put the battery and everything, it will be a little bigger. And this is one of the smallest robots at this present. Still, it is in the centimeter level. So there is no computer technology at the micron level, real micron level. So now imagine your bacteria, which is exactly the 225 micrometer. So if you can make a computer out of it, which can take the decision and work on the human objective, then we can get a completely new technology at the micron level, so new computer technology, and you can think of it as a lot of different kind of the application. And as it is a biological system, we can seamlessly integrate with the biology as well as the chemical system. And then lot of, I believe the imagination is the limit, what kind of things we can do. This is from application point of view, but there is another, I believe it is a much more fundamental point of view. Now, when you actually think about a student, okay, so and say he's a very intelligent or something. I know Partho because Partho is a very, very intelligent guy. And whenever, say, the Sangram, if you want to compare the Sangram with, nobody is going to compare Sangram with Partho. They will say Sangram's brain is like a donkey. So the whole point is, when you're comparing whoever's brain is, you are not going beyond mammals, right? Just donkey and human. But actually, if you go down in the evolution and look at even the bacteria, this bacteria has the ability to solve some of the problems. So for example, any bacteria who goes for the chemotaxic, it has to take a decision to swim or not to swim. Now, amoeba, which is another single-cell organism, it can actually differentiate between the good food and the bad food. Now, imagine we go to the paramecium, and if there's a food and the paramecium is swimming there, and if you just give an obstruction, then this paramecium is going to just hit the obstruction, but it is not going to stop there. It will come back and then change its direction and then again start to swim there. So that means it has another level of the complexity level, the way it actually solves this kind of
you have 2 more minutes to finish the talk.
Okay, yeah, in 1 minute I'll finish, I think. So what is the what important point is here, that even they are a single cell organism, they have this problem solving capacity, or it's what it called is the primitive intelligence. Now, when we are building a bacteria by stitching molecules of molecules, which can actually do some of the problem solving and the human design to a prime number, or before we have done the math solving and so on, that means we are trying to understand, we know the mathematics, we know how we are stitching the molecules, so we are getting much more insight about the origin of the biochemical intelligence, or this is one, and or other way we can actually think about it, it will give a new question that rather than the answer. For example, we know the prime number can be identified by a human or by a computer. But when I say now you have a bacteria which can identify a prime number, then the question is, how do you define intelligence and what level? So this is, we believe, is a new question may arise from here. And with that, I like to thank all my students, and definitely a lot of undergraduates work on our lab who also helps, and our funder. And thank you very much for your attention.
We have time for one question because he finished on time.
Okay, it's fine. Okay.
So with so much effort, we stopped the speaker, you understand? Because I was just discussing with her, we love the speaker so much that we are finding it very difficult. It was like asking my mother to get me up from sleep. She never managed to get me up from sleep because she was so sympathetic. So we love these speakers so much that we were having hesitations to stop them. And with all the efforts, we stopped them, and you don't have questions, at least. So
when you are engineering the pathways,
No, at this moment we're engineering the E. coli. This is not lactobacillus. Okay, but the methods we develop or the rules we develop, the structure we develop, this can be applicable to everywhere. So, for example, we are trying to work with the neurons, which is very difficult at this moment, but we believe that can be done to make this the faster. So, it is a much more general.
Okay, so my question is that if you take a real medical problem, suppose you are doing Alzheimer's disease or something like that, right? You know the most of the pathways, how the plaque forms is known. So can you implant that pathways into bacteria and follow the how it responds to the changes, or you can monitor those only?
Actually, theoretically, it's possible. We have also showed that, I haven't shown, but you can engineer the bacteria such a way and give a chemical instruction. And then this bacteria can go attack the cancer cell, and then 2 or 3 proteins it can actually downregulate, and everything you're giving the instruction to the bacteria, and bacteria is doing that by themselves. So
it could be
theoretically that's definitely possible, and future definitely that is the more possibilities in experimental level.
Thank you.
Yeah.
I will request Professor Lohia to ask the question, and then.
So, thank you, ma'am.
We got used to a computer in a certain way, which is almost idiot-proof. Like, you know, you have to tap this and you have to go. What you've explained is so complex. I'm sure that when the first computers were made with silicon, this kind of engineering happened. But do you think you'll have to synthesize the entire bacteria to follow your commands? Because E. coli or any other bacteria will have its own way to delete what you inserted, or will have its own way to refuse your commands. You know the permutations, how they
Yeah.
How are you so sure? How are you so sure that you can train the bacteria to understand your command and follow it?
So okay, how means, so for example, the experiment, in terms of the experiments we have done for 72 hours. Okay, so that is the maximum. So we know that till 72 hours it is robust. At the same time, when we have a 14 different cells, and we do the experiment, we put it in the fridge and do the experiments in 6 months. So at least we can say in that way it is 1 year, it is fine. But there is the
computer on 24 hours a day and night. How are you going to keep the bacteria faithful enough to get this, to recognize the command, not do its own engineering? You know they engineer themselves. How are you going to control this?
Oh, okay. So that's what I'm saying, ma'am. After 72 hours, we haven't done. So we cannot say that continuously we have done for 72 hours. So many generations of the bacteria, because all this genetic information they are also carrying. But I don't know what will happen after 50 days, for example. Right. So at this moment.
Are you going to synthesize all the genes?
No.
Are you going to, are you going to control the environment in a way that it is at the micron level?
Okay.
That you can organize.
So, ma'am, you can think about it in a computer. If I want to do a problem, you write a program. The same computer can do Facebook, but the same computer can do a research project. So here we are taking the cell's whole machinery. We are just making this artificial neural network, which is a small, and we also make sure that it is not interacting with the other parts based on the metabolic loads and so on. That will characterize. So, I mean, in that way you are building, but what I'm saying, the completely bacteria, we haven't, but I
Have you failed at something? Have you found a place where it's weak, where there is an HDC, where it's not recognizing your command, where you expect it?
Due to evolution, no. But due to our building, there is a parameter. So, but even if there is evolution, if you see the mutation rate, the whole point is this is called the distributive computing. So even a couple of bacteria fails, the other will actually take over. So that is the, at this moment, we are using. Maybe we discuss later, ma'am.
Okay.
Thank you.
Great job, Sangram. Our and you are the first speaker. Will have a peaceful lunch. Next is Gitanjali. So next is Dr. Gitanjali Sundaram. She had done a MSc in biochemistry from University of Calcutta with a gold medal. That means she stood first in MSc, and did her PhD in biochemistry from University of Calcutta, following which she went for postdoc at University of Illinois at Chicago, and then she joined Department of Biochemistry as a faculty in 2009, and she's going to assume the office of the head of the department from next week, I am told. And she has a lot of several high-impact publications, and her niche research interests include transcriptional program of cell division and understanding, the modulation of cell cycle progression decision in response to metabolic cues. So with that, Dr. Gitanjali Sundaram.
Thank you, Posabda. Of course, I have to thank the organizers for this wonderful opportunity. Without wasting much time, I'll go straight to the topic. So just to introduce the key characters in today's story. So these are the beautiful S-Bombay cells, Professor Bach. They can also serve as a good choice for your work. So we work with cell cycle regulation, and the beauty of using this particular cell is because a simple measurement of cell length can give you an exact information about what is their location in the cell cycle progression timeline. Just like every eukaryote, there is a cyclin-dependent kinase CDC2 which governs all of these decisions. It's of course only active when it's binding to its cognate cyclin CDC13, and of course the activity status depends upon the coordinated actions of the CDC25 phosphatase and the V1 kinase. Along with that, we are also interested in the MAP kinase pathway. In Bombay, the main MAP kinase, which is the human P38 homolog, is Taiwan, which is controlled by the upstream MAP kinase Vis1, and partial effectors of its functions are the transcription factors ATF1 and PCR1. So in our lab, we are basically interested to understand the crosstalks between these two pathways. And so far, we have established a few connections between these two pathways related to mitotic entry, related to mitotic exit, as well as connections that regulate periodic transcription. Today, I'm actually going to talk about the communication between MAP kinase Taiwan and the cyclin-dependent kinase CDC2. Before I go further into today's story, I would just like to give you a brief background of what we have already established about this pathway. So you have the MAP kinase and the cyclin-dependent kinase. What we had briefly shown earlier was that you could increase or decrease the activity of the cyclin-dependent kinase, and that would be directly translated to the concomitant increase or decrease of the MAP kinase activity. The MAP kinase can also sense perturbations that can disturb cyclin-dependent kinase activity, and it can restore those perturbations via multiple mechanisms. And we have shown that the communication between these two kinases is mediated partially by the Vis1 MAP kinase. So in today's story, what I'm going to tell you is that the communication between these two kinases can be significantly influenced by the metabolic state of the cell, and that can completely reverse the mitotic timing outcomes that we know that are regulated by the cyclin-dependent kinase. So the fact that metabolism can affect cell cycle has been indicated for a very long time, and intuitively it is very easy to accept that there would be such an influence. For example, a lot of important cell cycle related molecules have been implicated in many metabolic processes like gluconeogenesis, insulin secretion and function, adipogenesis, etc. In fact, if you look at the total network here, in this diagram, all the metabolism related molecules are marked in red, and all the cell cycle related molecules are marked in shades of blue. So you can see the intricate network here. This picture is far from complete, but it tells us that it's very important to understand these connections. If you look at the temporality of these processes, you'll find that a lot of metabolic processes seem to be restricted to certain phases of the cell division cycle. However, when I say it like that, because that is the way we have been trained to look at the cell division cycle. What if it is the other way around, that the cell cycle phases are actually restricted to a temporal state of the cell where certain metabolic processes would be happening? What if it is the metabolic cycle which is a dictator and the cell cycle is simply an outcome of that metabolic cycle, what if all cell cycle regulators are basically metabolic effectors? So that is the kind of theory that we kind of are pursuing in our lab right now. How did we jump into the effect of metabolism on cell cycle? It was this particular experiment that was done by one of my students. Till date, I do not know why she did this experiment, but I'm glad she did it because that changed the way we looked at cell division in our lab. So what I'm showing you here is wild type fission cells cannot use lactate as a source of energy and they're not very viable. However, a mutant fission cell, CDC23W, which has extraordinarily high cyclin-dependent kinase activity, starts utilizing lactate. So that was very surprising to us, and we took it up to understand the mechanism. Lactate is a very important molecule, but for the sake of time, I'll skip its significance and go straight into our results where we've tried to understand these phenotypes. So as you can see here, when you take wild-type S-form-based cells, they grow slowly in lactate and they are not very viable. They accumulate a little bit of DNA damage, but also one more thing is that they start accumulating at lower cell lengths at septation, which is an indicator of premature mitotic entry. So that tells us that when exposed to lactate instead of glucose, they try or attempt to divide very fast, but however, they fail to remain viable. We then repeated our experiments in the presence of a MAP kinase inhibitor. So you can see here that when you add the inhibitor, the cells are rescued from the slow growth. Not only that, they start surviving. So it's the same wild type cell but starts surviving, and the cell length is also restored. So a simple inhibition of the MAP kinase can reverse all the deleterious phenotypes that a wild type S-form cell faces when exposed to lactic acid. Now this is very contrary to the accepted role of this MAP kinase, which is more like a guardian molecule, helps the cell to grow properly, helps the cell to divide properly. In lactate, it seems it does the opposite. It prevents the cell from growing properly, prevents proper cell division. I'll skip that. Because the communication between the MAP kinase and the cell cycle machinery we had earlier shown to be dependent on the MAP kinase WIS1, what we did was we repeated our experiments in a WIS1 deletion background. We found that none of the phenotypes were reversed, which tells that in this case at least, either there is no communication between the two kinases, or even if there is a communication, it does not depend on this WIS1 MAP kinase molecule. So one of the ways in which we had earlier shown that STI1 can regulate cell cycle is via the modulation of the activity of the CDC25 phosphatase. Now this is a positive regulator of cell cycle. So if you overexpress CDC25 in the cells, they will enter into mitosis very, very fast and the cells will be very short. However, when these cells are shifted to lactate containing media, you see that they start becoming longer, which is a marker of delayed cell cycle entry. So again, we are seeing that when you put lactate into the cells, even the functional identity of a very important classically recognized cell cycle activator can be reversed to something that starts delaying the cell cycle. Now, this was inexplicable to us at that point of time because it's very difficult to accept CDC25 as something that delays cell cycle. But when we looked at the localization of CDC25, we found it was severely mislocalized and it's in certain puncta scattered throughout the cell and it's not inside the nucleus. So, of course, if it is not inside the nucleus, it cannot accelerate cell cycle. We knew from our earlier work that STI1 can cause CDC25 mislocalization, and because in this case, you can see that the STI1 activity in the levels is very high. We believe that that is how it's happening here. Nevertheless, STI1 again is behaving contrary to what we know about it. CDC25 functional outcome is also contrary to what we know about it. So we now come back to the mutant which opened this Pandora's box, the CDC23W mutant, which has a hyperactive CDK. So you can see that whether you have lactic acid or glucose, it's quite viable. It grows a little bit slowly, but the remarkable thing here is these phenotypes are insensitive to the MAP kinase inhibitor. Adding the MAP kinase inhibitor does not change the phenotypes. So again, there's an indication that the communication is severed here. Surprisingly, when we looked at the cell cycle phenotype, now this is a hyperactive CDC2. So the cells are supposed to undergo premature mitotic entry, but see in lactic acid, they become longer, which means a mitotic delay. So again, once again, something that was classically accepted to accelerate mitosis is now functioning as something that delays mitosis. And we believe because CDK mutation in this case allows a delay in mitosis, that is how these cells become viable. You can also see here that there is no DNA damage that we saw in the wild type cells. Then we went into a different mutant here. Because of our interesting leads with the CDC25 experiment, what we did was we took the CDC2 3W mutant and we deleted CDC25 there. We looked at the growth, we looked at the viability. The response was absolutely similar to the CDC2 3W mutant. It was insensitive to the MAP kinase application or inhibitor application also. But when we looked at its mitotic timing phenotypes and DNA damage phenotypes, the phenotype started looking similar to that of the wild type cells. So some of the phenotypes were similar to the CDK mutant, some of them were similar to the wild type cells. This tells you that the mechanisms that are governing cell cycle progression, mitotic timing, and the mechanisms that are governing cell growth and cell survival are disconnected in this particular case. So the response to lactate is very different from what we normally think about cellular response to metabolic environment, where cell growth, cell cycle progression, cell survival will all be tightly linked. So here we see an unlinking of those mechanisms. We then looked at the Stivin activity levels in all of these cells, and you can see that the activity levels are the lowest in the CDC3W delta CDC25 mutant, and they are highest in the CDC3W mutant and intermediate in the wild type cells. So we believe that the variations in the response to lactate in these three different kinds of cells are probably due to their variations in the phosphostivin levels. Why we think so is because in an earlier paper, we have shown that this particular stivin molecule is a dose-dependent regulator of mitosis. At low doses, it can propel mitosis. At high doses, it can inhibit mitosis. However, that correlation which we could see in a glucose environment, we don't see in a lactate environment. When we try to understand that what would be the mechanism here, we also found that the levels of the stivin effector ATF1 transcription factor were also different in all of these mutants. However, the nature or the qualitative nature of variation was not correlating with the nature of stivin variation that we earlier saw. So that means that there are additional factors involved here which are actually regulating the response to lactate. So till now, whatever I showed you was stivin does not work the way it is supposed to work. CDC25 does not work the way it's supposed to work. And a mutant with high CDK activity does the opposite of what it is supposed to do. So in order to understand whether the dysregulation is actually that severe, this time we took a mutant which has low CDK activity instead of high CDK activity. So the TS mutant, you can see when you shift it to a non-permissive temperature, the cells are elongated because the cells are activating a G2/M checkpoint. However, when you shift these cells to lactate-containing environment, you see that they are still small. There's no elongated phenotype, means that the checkpoint activation is totally abolished in these cells. So this is again very surprising because you have inactivated CDC2, but you cannot activate the G2/M checkpoint. And we are talking about very simple organisms. There's absolutely no redundancy when it comes to the cell cycle regulatory CDK here. So that's very surprising. The other thing that we saw here, that while in a glucose-containing media, changes in CDK activity reduce stivin activity, in lactate media, it could not do so. So definitely the connection between stivin, CDC2 and WIS1 are completely severed simply by shifting the cells from a glucose environment to a lactate environment. So this is what I showed you till now. Everything that we had previously established about cell cycle regulation in glucose was completely reversed the moment you added lactate to the media, okay? So now we wanted to understand why this was happening, and we understood that before looking at the cell cycle regulatory molecules, we have to understand a little bit about the altered metabolism here. When we were looking at STY1 localization in these cells, we found that the localization of STY1 is very similar to what has been reported for STY1, sometimes being localized to stress granules or sometimes being localized to mitochondria. So we looked at the ROS levels in these cells, and we found that particularly in case of the CDK mutant, addition of lactic acid was suppressing the ROS levels there. So it seemed like that lactase was somehow giving a redox protection to those cells. So we thought, why not repeat the experiments with an antioxidant instead of just adding lactate? So we did that. We added an antioxidant to the cell, and we found that the nature of mitotic timing variations that we found for lactate in wild type and the CDK mutant were identical by simply adding an antioxidant. So the ability of lactate to suppress ROS levels in these cells was affecting mitotic timing. Of course, we don't know how. As expected, the oxygen consumption rate of these mutants was very high. And the reason why they can actually grow very well in lactate containing media is because we found that they have elevated lactate dehydrogenase activity, which makes them capable of utilizing lactate as a source of energy. So this is a summary of what I have told till now. Where we are now working in our lab is when we replace glucose with lactic acid for the cell, it could mean two alternative things. One, it could mean that there is availability of lactate in abundance, or it could also mean that it's a non-availability of glucose. So the response could be dictated by either of these. So we had to distinguish between these two possibilities. So what we did was, in order to understand whether it's actually lactate which is doing all this, instead of replacing glucose with lactate, we added glucose and lactate simultaneously. But the cell cycle phenotypes that we saw were identical to whatever happened just for lactate. So probably it is lactate which is bringing about all this. When we shifted the cells to low glucose in wild type cells, again we surprisingly found that the phenotypes are very similar to what we found for lactate. However, the deciding factor was the CDK mutant. When we added glucose for plus lactate, for the CDK mutant, the phenotypes were identical to the lactate addition scenario. However, for low glucose, they were similar to wild type. So that kind of establishes that it is not non-availability of glucose, but is actually availability of lactate that is triggering these changes. Of course, I'll end with one interesting data. The cell cycle checkpoint abrogation that I showed you when we move the cells to lactate happens even when we move the cells to low glucose. So there is a huge contribution of the metabolic environment of the cell to how cell cycle checkpoint mechanisms are working. There's a poster from my lab, poster number 6, which actually explains the effects of glucose. If you're interested, you can see that. So Priyanka is the person who started with this project, and Sushmita is now taking it forward. So I hope I finished well within time.
Well within time.
Yeah.
So the perfect timing. So questions, can I?
Fantastic. Very well done, and bless your student who did that. Gitanjali, have you checked the sirtuin pathway? Because in low glucose, sirtuin pathway gets activated, and you see it gets activated.
Yeah.
And the idea of metabolic, many of these cell cycle checkpoints being metabolic effectors, these did it in a very primitive organism in amoeba. And when we shifted from glucose to butyrate, which is the normal food available in the large intestine, we see this difference.
Okay.
We also saw this difference if we switch from axenic growth without bacteria to xenic growth for amoeba. Okay. Because in the intestine, they grow with bacteria. Okay. So you see a huge, and these bacteria are eaten by the amoeba. So metabolic, yes, many of this, you are lucky that you work in Bombay where you can do genetics. In our organism, that was not possible. But we had preliminary results which really are, I'm very happy to see you taking it to a molecular level in Bombay. But do check out the sirtuin pathway. Caloric restriction starts off the signaling of the SIR2 pathway, which allows the cell after lag period to grow forward. So it's not just lactic acid, in my guess. I may be wrong and I hope I'm wrong. But caloric restriction, which is immediately available. Glucose is easily, our cells have been trained for that.
Yeah, right, right.
Do check the SIR2 pathway.
Sure. Yeah, I wanted to ask you that since your antioxidant was working, do you think there is an oxidant which is acting as a signaling molecule there? Or have you detected any?
No, but yeah, that possibility is also there. But at the same time, so lactate, if you just add lactates and whatever we know about metabolic pathways, increasing lactate concentration should not decrease ROS. It should actually increase ROS because of the way it interferes with the glucose metabolism actually. But in this case, we saw the opposite. So we are trying to understand whether the role of lactate as an epigenetic regulator is what is triggering a lot of diverse metabolic changes here, including the increase in LDH activity, because in Pombe cells, LDH activity is classically suppressed. But maybe adding lactate in a particular mutant background is increasing it. But like you asked, whether any other oxidant we could detect which is bringing this about, no,
There are specific inhibitors for specific oxidants.
Yeah, I understand, yeah.
So Gitanjali, very nice talk here.
Yeah.
Okay. So it's very fascinating to see you have mapped LDHA, possibly regulating the lactate pools. I was just wondering, like we know hypoxia or oxygen deprived condition actually turns on LDHA and has some biological function. So in this context, have you thought about creating such kind of environment such that the yeast responds better with the lactic acid?
We could, but at least in wild type cells, whatever data is available, no, there is no LDH upregulation. But at the same time, what we did was, once we found that data, we looked at the LDH promoter and we found a Sty1 binding site there. So we are thinking that Sty1 is doing something wrong there. So let's see. Yeah.
Thank you. Yeah.
So with that, we thank you, Gitanjali, for fabulous talk. And with that, on behalf of Chandrima and me, we would thank the university, especially Professor Dhubajyoti Chattopadhyay, for giving us the scope to, and sir is also my research mentor and teacher, so giving us the scope to at least witness such a fantastic session, and I mean, closely watch some of the most brilliant scientists of the city. So thank you so much. With that, possibly we can declare lunch. Oh, so sorry. So we'll hand over the this thing to stage to the organizers. Thank you so much.
Thank you so much for this wonderfully coordinated, insightful session. Now we are going to head towards the felicitation of our invited speakers and our chairs for this session. May I call on stage all the four invited speakers for this session, Dr. Benubroto Das, Dr. Partho Chakraborty, Dr. Sangram Bagh, and Dr. Gitanjali Sundaram. And may I request our chairs for the session to felicitate our invited speakers. Please. Now, may I invite on stage the conveners of this conference, Dr. Amit Shorkar and Dr. Sudipto Shaha, to please come up and felicitate our chairs, Dr. Kaustubh Panda and Dr. Chandrima Das.
Thank you, all the dignitaries. And we will request you to stay back on stage for a group photo, and we'll also ask the participants to join, and also the dignitaries, the delegates. Please come on stage to join for a group photo. And before lunch, there is one announcement. Sponsor, Imperial Life Sciences, have given a stall near the area where we have served morning tea. The stall is there. Please visit the stall. And now we can break for lunch, and we come back in due time. We have
but now she is in a much better place than, ISAR. And she uses computational microscope to look at small tiny protein molecules and their interactions and dynamics and how they interact with nanoparticles. And she will use this talk to springboard into the panel discussion that we will have. And I think it's half an hour talk, is it? Or I don't know, it has been shortened now. Half an hour, yeah. Niranjana.
So thank you, Professor Chakraborty, and this is a tremendous privilege to be here. And I thank the VC, Professor Chattopadhyay, and the other organizers for the invitation. And this is actually a special privilege because one of my students is a faculty member here. So, I'm really, really happy to be here. Okay, so as Professor Chakraborty said, this is going to be, I'm kind of going to do an overview, a bird's eye view of this issue. And I hope I would be able to sensitize the biology community into the things that, the good, bad, and the ugly of, artificial intelligence in biology. An introduction to that, or the good part of it, has already been introduced by Professor Shangram Bag. He's making extremely innovative use of artificial intelligence and, using, designing logical circuits with bacteria. So one thing I just wanted to say is that in today's day and age, we are all encountering artificial intelligence one way or the other. Today morning when I came from ISAR Kolkata campus, we were using Google Maps. I think, most young people, anybody under 30 who has not used ChatGPT, I don't know. We are using Google Gemini, we are using Alexa, we are using it all the time, right? So like it or not, this artificial intelligence has crept into our lives. And for the record, this explosion happened after 2010. If you go back, I did some reading before coming here. So it was there. The 2024 Nobel Prizes, 2 of the Nobel Prizes in physics and chemistry, but how they are, they're coming into the biological picture. I'll actually take a couple of detours and, please pardon me if this is already, if this bores you, but there we go. When we talk about the molecules of life, we have lipids, very broadly speaking, lipids, proteins, polyamino acids, polynucleotides and all of that. They organize in some way, okay? And then they give rise to manifestations, that is really the biological sciences, right? So everybody here is familiar with the central dogma, so DNA actually goes, so this was by Francis Crick some decades back. DNA goes to RNA and then you give rise to these proteins, which are the actual machineries of life. And so if we have these polypeptide chains, then we can attempt to understand the physics and chemistry of life, based on these. Now, this physics and chemistry of life, this polypeptides, they will not function, generally speaking, if you just leave them as an extended chain. In other words, they need to adopt certain specific structures, and that too very quickly, okay? So otherwise, they are useless. If you kind of, rumple it up, it is not going to be very useful. So coming from this central dogma, down to how do we know that the information at this level will give rise to a specific structure at this level? And the earliest experiments, again, probably I'm being at the risk of being redundant, I will just say it. It was, Anfinson's work in the 1950s going on to the 1960s, which actually, gave us this hypothesis, or it was his hypothesis at this time. We refer to it as Anfinson's dogma. And he focused on the ribonuclease. Actually, he looked at many ribonucleases. I'm going to ignore not ignore, I will not highlight Moore and Stein here. But Anfinsons was given the Nobel Prize for making the connection between the amino acid sequence and the biologically active conformation. In very short, what he did was, so this is from a science paper he published after the year after he got the Nobel Prize, that is 1973 is when he published. If you have this ribonuclease with 8 cysteines, which can potentially make up to 4 disulfide bonds, and if you assume that they are happening in a sequential order, you can actually work it out. Very simple math, you can have up to 105 disulfides possible, okay? Now, if you randomize the whole thing, okay, it turns out that the enzymatic activity reduces to less than 1%. That is 1 by 105, less than 1%, which means there's only one disulfide pairing, okay, which is going to have this thing function as, as a ribonuclease. And so this is a science paper I was referring to. Okay, I will not go into the details, but he used urea to break the non-native contacts. He used mercaptoethanol to actually clear, protonate the cysteines. But he gave this paradigm of sequence to structure to function. Okay, and he actually said, he stated it, I have actually picked it up from that science paper. This process is driven entirely by the free energy of the conformation. Okay. That is gained in going to the stable native structure. So that was, a very clear statement at that time. I think Anfinson's experiments form parts of, biochemistry, lab experiments maybe. I've found in some places, but that was a very clear statement. The question is, how does it happen? But before we come to that, there are 3 thermodynamic lessons if you kind of revisit Anfinson's work now. Structure arises predominantly from non-covalent forces, okay? Not from chemical bonds per se, but from these contacts, okay? Which are stabilized by, unknown factors. There's cooperativity in folding. So another set of interesting experiments were done where only the active site residues and some scaffolding residues were taken. And it was thought that, okay, we are going to have the same enzymatic activity. It didn't happen, okay? So which means that there's a lot of cooperative behavior on how this enzyme is actually functioning. And the third lesson is that when you have a protein like this, I had a movie of ribonuclease. I don't know if that's going to run, but maybe in the interest of time, I'll forego that. That is the ribonuclease. I had my student run a movie of that. But to get to the native format, you can actually have structure kind of initiated in different places. This is especially true if you have multi-domain proteins, okay? So you can have segmental nucleation in the folding process. So given these lessons, over the last some 50 plus years, there has been tremendous effort in understanding how and why proteins fold, and especially can we predict the functional structure of the protein just given the sequence, okay? So this has been a problem that refuses to be solved in a way. And I'll not go over all the efforts that happened, but I think this relatively recent review article, 2020 by Symphony and Linder, that's a good encapsulation of, of this crosstalk between computations and experiments to, elucidate the structure. You have certain experiments which are low resolution, you have certain experiments which are high resolution, for example, X-ray crystallography, and then given that data, how can you actually, complement it with in silico methods to, come up with the functional protein structure. So that has been going on for some time. Now, so there were some thoughts about a game-changing thing, right? Why do we really have to work hard? Professor Chakraborty might correct me, but I think back in the day, crystallizing one protein would roughly yield one PhD thesis. There were days such as that. Now, the thing is, people started asking, can we use other methods, right? Can we do some bypassing? So there was more and more thought into using data-based methods because thanks to crystallographers over several decades, a lot of data was accumulated. And remember, I said non-covalent forces are very important. So if you know who has a propensity to interact with whom, amino acid A with amino acid B, what is the overall density and what is the overall probability distribution, can I actually make some reasonable, guesses as to the structure? So hence, and none of us expected it. The 2024 Nobel Prize in Chemistry went to these three people, and the press release simply said they cracked the code for proteins' amazing structures. That is a one line, that's the primer for the press statement, that is. And it was released on 9th October. I want to highlight the date here. It was Durga Puja for us. I don't remember what day it was. But the day before, so interestingly, I'm just diverting a little bit. I was teaching the second year biophysics course, and it was a holiday. But I actually wrote my class 2 emails. I don't know if they cared about it during puja, but I did. Note this name, 9th October. I'll just take a short detour to the Nobel Prize in Physics. The same year, okay, similar press release one day before, 8th October. Okay, and they're saying they trained artificial neural networks using physics. Okay, and then I had the chance to talk to some physicists who are not happy with the Nobel Prize. So there's a lot of debate because they think that computer scientists were given the prize. Some computer scientists think physicists were given the prize, vice versa. But why is this important? And I'll go back to what Shangram introduced. Thanks, Shangram, before. Artificial neural networks can play very important roles in biology. But before that, I would like to kind of make a distinction between artificial intelligence methods, which are, again, at the end of the day, computer programs, versus more conventional computer programs. In more conventional computer programs, I've taken Monte Carlo as an example. You give specific instructions. If this happens, do that. If these two things happen together, do that. If that happens, assign a certain probability to this. So every piece of instruction is human given. Whereas in artificial intelligence, what we are trying to do is imitate human intelligence, right? Given a scenario, figure out what to do. Okay, make your own instructions. Okay. Now, within the supra set of artificial intelligence, you have something known as machine learning is a subset of that. It improves performance with more data and time. And within that, you have deep learning. So broadly speaking, computer scientists might disagree, but artificial neural networks and deep learning are more or less, they kind of indicate the same thing. In deep learning, or you have neural networks which learn from vast data sets. Okay? So if you connect the dots, you will realize that, over some 60 years or so, thanks to protein crystallographers, vast amounts of structural data had already been accumulated. And we already knew the contact probability distributions between different pairs of amino acids. Okay? So I'll just kind of do a very, dummies kind of introduction to artificial neural networks. So it kind of tries to replicate the human brain, okay? So here I think, this is just a snapshot of what a brain neuron looks like, okay? So essentially what you have is a replication of this, okay? I would just like to again take a short detour. This idea was not new. This idea is actually more than 80 years old. If you dig into the literature, McCulloch and Pitts, they first thought, these were psychologists, okay, who thought that, can we try to make a program that will replicate human thinking, okay? And then Donald Hebb, okay? So these are the people who are the early workers, 1940s, okay? And nowadays we have something known as the Hebbian rule for artificial neural networks. Essentially, if you just look at it by analogy, okay, this is again a very layperson's description, your dendrites from which you get information are the input layers, okay? Then you have the nodes, which are kind of analogous to the cell nucleus. And again, you have these synapses, okay, where you have, these, you can actually weigh it out. And there could be a little bit of a different description of this as well. But more or less, we are trying to replicate a neuron. And more than that, if you know, several neurons work together. The input of one is the output of another one, and you can have, networks of neurons. So with this idea, people try to make networks. So John Hopfield, okay, who was one of the physics Nobel laureates, he reported the first network in 1982, to the best of my reading. And this guy is really, John Hopfield, he literally hopped fields. He went from solid state physics all the way to, in the 1980s, he has papers on spectroscopic studies of hemoglobin. Okay, he has papers on DNA replication and DNA repair and things like that. But what he thought was, could emergent collective phenomena, as you have when you have collection of neurons in your brain, you have collective phenomena. Can we replicate that with, can that kind of reflect computational abilities? So with that, and I just want to, highlight this paper, and I really want you to focus on this. It's a PNAS 1982 in the subfield of biophysics. Okay, and this person got the Nobel Prize in Physics in 2024. Okay, and he was in the molecular biology department of Princeton. So how much interdisciplinary can you get? So these were recurrent, fully interconnected networks, and every processing unit was connected to other units. Okay, so this is an important point. But what Hopfield's network did was, they had binary nodes. Okay, so you have SI, let's say a representation of a node. It can either be 0 or 1 with a certain weightage. Okay, and then you can, recursively propagate the node. And he defined a network energy. Okay, very simple definition. But then it is not just one node. It's maybe hundreds or thousands of nodes. But if you kind of activate that node, turns out that it is always going to go, it's always naturally going to go into the lowest energy conformation. Now that is something that was not necessarily, a very useful thing. So Hinton, the other Nobel laureate, actually kind of introduced some stochasticity. It was a stochastic extension of Hopfield's network, and he replaced the binary states with Boltzmann probabilities. Okay, so Hinton's idea was referred to as the Boltzmann machine. And the network energy, in addition to this part, he also introduced a local bias. So how this network is propagating will depend on, what kind of signal or what kind of excitation or what kind of impulse you are giving locally. And the important thing I want to highlight is, Hinton's Boltzmann machine was a generative model, which means that the output was similar in nature to the input. In other words, the output that you generate, and this is a point I'm going to come back to later on, it can add bias, it can be used to train further models. And the focus was in statistical and not individual patterns, and I've highlighted, the two key papers which are cited in the Nobel literature. So, and then the other distinction was Hopfield and the initial Hinton models were both recurrent networks. So basically it would go back and forth. But maybe I don't have, okay. So Hinton's, all right, let me skip to the next one. So what the further development after that, and this is relatively recent, 2002, Hinton actually introduced the restricted Boltzmann machine. Okay, so with that, essentially what you're going to do is within a layer, different nodes will not communicate. And that kind of led to the advent of backpropagation along with feed-forward machines. Okay, so all in all, so this is where we stand. I've done a very gross overview. There's a lot of technical similarities, dissimilarities, variances in the models, etc. But generally speaking, this was the idea. So what happened was, as you see, I already mentioned this, the 2024 Nobel Prize was given in chemistry was now given to David Baker, Hassabis, and John Jumper. So David Baker got half of it for computational protein design, and the other half went to these two people who were in Google Mind, I'll come to it, for protein structure prediction. So as you realize, that was the holy grail. That is what people wanted to do. I'll focus less on David Baker's work today. So what David Baker was able to do is to actually design proteins that did not belong to the genome at all. Okay, completely new folded structures which are kind of genome defiant rather. Okay, and he said that you can design proteins, you don't have to be a scientist. So he has this program, Rosetta at Home, which is available from his, anybody can access it. And he also has this beautiful little program called Fold It, where even children can actually take different combinations and design folded states. And what David Baker, I understand he has a group of 60 people in the University of Washington. They design these novel synthetic proteins, which have huge ramifications for drug design and molecular therapeutics and the like. Today I'm going to focus a little bit more on Hassabis and John Jumper. They are the director and the chief operational officer at DeepMind, which is an offshoot of Google based in London. And they designed, or they reported, this program called AlphaFold 2. And I'm sure at least some of you, some of the students here are using it. Okay, up to a certain number of residues, it's a free package. Okay, you can simply upload your sequence. For short sequence, the sum structure comes out in half an hour. For others, it takes more. They got the prize for protein structure prediction. And exactly what did they do? Oh, I had an animation here which is not working. So I've just taken screenshots of the PDB database. I'm presuming everybody is familiar with the PDB database. If you see, okay, as of 2023, there was this, I think that the first entry there, they were very excited because there were 2,000 plus, 2 lakh plus entry, 200,000 plus entries in the PDB database. As of yesterday, I just took the screenshot yesterday, there are 230,000 structures from the PDB. Look at the second line. There are 1.06 million entry computed structural models in the database. Okay, and this flood of structures happened over the last couple of years, 2022 to something. So now we have access. So this is generative modeling. So now is the decision point. Do you really want to build your models on experimental structural data? Or if I were to take those 1.606 million data and feed them again, is that the right thing to do? Okay. And the good thing is, they have separated. They have not mixed the two data. So that is a good thing. And what you will find is, I went back yesterday, there are some, so you see scientific name of source organism. You can search by organism. There are some 28,000 proteins that belong to Homo sapiens, okay? So they have taken major parts of the human genome, fed it into AlphaFold and reported these structures. Now, would you trust them or not? That is something that, if you, my message is, if you trust these blindly, then you're probably omitting a lot of things, huh? And then they can randomly see. Okay, so these are, so PLDTTs, it's a global score. It tells you how good that structure is. They have really high scores, 93, 80, 84, so on and so forth. They are all, sequences taken from the human genome and structures reported. All right. So this is what AlphaFold is able to do. I'll just quickly, I've kept some of my own work at the end. But I just want you to know or kind of get an understanding of where this began. So there is a biennial competition called Critical Assessment of Protein Structure, began in 1994. Every 2 years you'll get this. And there were some key competitors, who would participate in this. Nothing would be given to you. Only the sequence, only the gene sequence. And there would be some set of experimentalists who had already done the structure, but they would keep the data hidden. So you do some kind of a from scratch protein structure prediction. And as you went forward, okay, so this is a global, that GDDLT score, anything above 90, let's not get into the, you can read the papers and ask why it is so. But if you score at 90, then you have bypassed experiments. Your reported structure is actually at par at 90 with experiments. And you see what happened. In 2020, there was a significant jump in AlphaFold itself. The AlphaFold was the original version, 2018. AlphaFold 2, which is the newest version, which won the Nobel Prize, is nearly 90. Okay, and these are the RMSDs from the experiments and so on and so forth. It gets better by the day. This is the paper. For those of you, perhaps the students who really care to know which paper got the Nobel Prize, this is the Nature paper reported, and you can see John Jumper as the first author and Demis Hassabis as the last author, and a bunch of people in between. Okay, so this contains all the details. I will obviously skip the details, but this is roughly the architecture. The two important parts of, the heart of the architecture, you have two blocks, okay, which are known as evoformer and the structural module. And this, I picked it up for, so if you go to the press release of the Nobel Prize, there's also a more advanced information module, and this one was put together by Johan Lindqvist, structural biologist in Uppsala. In the Evo former, you have multiple sequence alignments, okay? And then you have some kind of a contact pair representation, and you kind of co-evolve both of them. You refine the MSA and the pair representation together, and you feed it into the structural module, and this is what I thought was very cool. Every residue was treated as a triangle, okay, between the N, C alpha, and C. So you had these bunch of triangles kind of floating in the air, They call it a residue gas. So apparently this trick worked very well, and there was a feedback between these modules. So this is at the heart of AlphaFold 2. All right, so now let's look at some results, all right? So here I asked my students, the Mandira, Poshuki, Sanjana, Devajita, anybody can do it. I'm sure many students here have done it themselves. So these are what you would get. In gray are the AlphaFold 2 structures, and in the other colors are the experimental structures. Now I just want to point out a few things. Okay, so this is the HSP protein. Okay, in red is the actual crystal structure, gray is the AlphaFold structure. Potassium channel. Okay, this is the closed form of the potassium channel. And I will tell you later that membrane proteins do not produce good results when you use AlphaFold. But why is this an exception? Because the KCSA channel was already reported by Roderick McKinnon. Okay? Similar with alpha-synuclein. We know it's an intrinsically disordered protein, but what it's giving you is this, micellin bound structure kind of a thing, because, this is available in the PDB. But you notice that the disordered parts are a complete mess. There is very poor disagreement between the disordered parts and the... Now, if AlphaFold is there, one question is, what do the rest of us do? Does it render the rest of every other structural biologist's work redundant? That's the question. The answer is AlphaFold cannot answer everything. Okay? So in proteins, we have this aspect called polymorphism, which is one protein can adopt many different states. So sometimes the so-called native state is metastable, and that is something I will highlight again. Again, for folding of membrane proteins, okay, you will probably not do a good job if there is not some structural data available. Remember that the original database, the crystal structures, they were mostly on folded proteins. Okay, so the neural network is anyways biased towards folded proteins. Okay, so if you feed in things which actually fold in this amphiphilic bilayer, you're not going to get good results. It will also not give you, let you know the mechanisms. So if you take a folded protein and subject it to perturbations, okay, chemical perturbation, thermal perturbation, other kinds of physiological perturbations, it might adopt a different state, which AlphaFold will not tell you about. And again, it does not give you any insights about biophysical mechanisms. I think some of us were there last year when Professor George Rose visited in Bose Institute, and that was before the Nobel Prize came in. And he said exactly that, folding versus the mechanisms of folding, and we don't get much information. So I believe I have some time. What I will do is, I will try to elucidate, these three deficiencies that I'm telling you. I will just use my own work to tell you a little bit about that. So for some time now, we have been looking at, we have been, tinkering with at least a few kinases. So this is the Abelson tyrosine kinase, okay, reported, whose structures in the active as well as two inactive states were reported by Kalodimus and Senjutz in 2020. These were solution NMR structures. So what we did was, what I've asked my students to do is, again, AlphaFold is the gray structure, and the others are the other colors, okay? If you take the experimental structures of the inactive and the active state, and at the macro level, they look very similar, but you see, AlphaFold is only capturing the active state. The inactive state, the loop that you see, okay, this is the activation loop, and it's completely out of sync, okay? In other words, the states which are not predominant will not be captured. And if you go back to the experimental data quickly, the active state is more predominant. It takes 88% of the ensemble. So I will just shift gears a little bit. So what do you do in such cases? So I'm just going to take this opportunity to tell about, some of the work we have done in recent years. How do you capture kinetic barriers? Okay, in, when you have very complex systems. So I have my friend Shuman here who is an expert in this, but, this is hard work. Okay. Defining the reaction coordinate and finding the location of the transition state and reporting the barrier. It's a huge computational challenge. But some years back, we actually came up with unsupervised, relatively simple unsupervised machine learning model, which we called expectation maximized molecular dynamics, where we actually, if you have data, if you know some of the states, you can actually make an attempt to connect those states. And I will, if people want to know, I'm happy to talk about it. In very short, we use Bayes' theorem to do this, okay, to kind of come up with the position of the transition state. And it looks like that, I'm not showing you the test cases, but it seems to be doing a reasonably good job. More recently, we have tried it for the Abelson tyrosine kinase, okay, and my student had worked very hard to kind of look at the hydrophobic pockets and the DFG and the activation loop together. And we reported, okay, so we could correlate the different conformations, the active and the inactive conformations with these DFG flips and everything. And, there were some more details. I will kind of skip some of the details. We determined which dihedral angles are actually responsible, are likely to be responsible for these changes. And we could, at the end of the day, the diagram that you see here is a free energy landscape. We are reporting the energy landscape, the energy values here. A is the active state, B is the inactive 1, C is the inactive 2, and we could reproduce the, the free energy barriers quite reasonably. More recently, we have been looking at a putative membrane protein. This is only the last 2 fragments of bacteriorhodopsin. Bacteriorhodopsin is, I understand, the first protein that was, folded in vitro. And what we did was, we took solution NMR data, which is reported in a membrane mimicking environment in chloroform methanol mixture. And we trained an autoencoder. And we were able to get, again, this is a free energy landscape. Free energy is in kcal per mole. Okay, so in blue and red, we have highlighted the conformational landscapes. We designed one more algorithm, and we actually tracked down the pathway from the folded to the unfolded state. I'll skip some of the details. Again, what we were also able to do, this is also a neural network, okay, a graph neural network, but we could, okay, so these are the hidden layers that we have. Okay, there are multiple nodes at each layer. We were able to track down, I hope this will run. I can't run this, but is there a way? I don't know why this is not running, because it's in the ye mode. But, I would like to, anyways. So you can actually see, the layers that you see there, those are not actual membranes, but we could train the curvature of the membrane based on the protein conformational information. Oh, it's going, but that's going to be a bit slow. You can actually capture a midpoint state and track down the membrane curvature with this model. All right, and previously also we have done quite a few things. The point I'm trying to make here is, if you're interested in mechanisms, if you really want to understand how, say, entropy and enthalpy are interplaying, you cannot simply go to an ANN such as AlphaFold and just trust it to give you mechanisms. You have to do more specialized things. So in summary, artificial intelligence can significantly impact science. There's no 2 statements about it. AlphaFold eases out protein structure determination primarily for soluble proteins. When you're thinking of polymorphism or membrane-associated folding or perturbations, you still require to think. You need human intelligence. Mechanistic studies are necessary for complete understanding, so we also need to be cautiously optimistic. While this is extremely useful, but we really need to know what we are doing. Do we really trust the data that we are getting? And we are still not at a stage where we can be lazy and assume that a neural network will do the job for us. And as I thank you for listening to me, I would also like to thank my collaborators from whom I learn every day so much, Rahul, Suprate, Morno, Ashish, my student who's sitting in the audience, and Martin, who I visited as a Humboldt Fellow. And that's my group. This is a 2-month-old picture, and I would like to also thank the, the support agencies for supporting our work. Thank you very much.
I think we'll move to the panel discussion. I don't know how it will, you will get some chairs here or?
You can take that off.
Thank you. We open the panel discussion.
Yeah, good afternoon. Is it audible? Thank you organizers for inviting me here. It's the first time I've come to Sister Nivedita University. It's a beautiful place. But I'm not sure if I'm qualified to be in this group, because all the important work that you have heard in the last talk has happened after I retired. So it was, I'm not really aware of all those things happening. The thing that I was aware of in 2014, John Mould, he started a competition, CASP, Critical Assessment of Structure Prediction. I was aware of that. And basically what all the predictors whose profession is to predict protein structure, they used to submit the model for some unknown structures, whose structures have been solved by crystallography, but they have been withheld. They were not published before the experiment was over. So it has been happening like that every 2 years, and there were incremental advancement. But in 2020, these two people whom, where is, she's not, anyway, she's not in the, anyway. No. Okay. So John Jumper, Demis Hassabis, they predicted, they announced this AlphaFold software that outperformed all other structure predictions, including the Rosetta by David Baker. So that was an astounding, and they get the Nobel Prize within 4 years in 2024 in chemistry. When I look into their biodata, John Jumper, he was born in 1985, about the age when we apply for assistant professorship. So by this time, he has got the Nobel Prize. If you look into his citation, it was, I think just yesterday I saw, H index 28. Many of us have got H index more than that, but but his that Nature paper, it had some 38,000 citations. So he is in the limelight, and since I looked into the biodata, I may ask the students, do you know who are the oldest and the youngest Nobel Prize who got Nobel Prize in science? Oldest? It was 2019, I think John Goodenough for lithium-ion battery. He was 97 years old. And the youngest, I think, was William Bragg, who was, I think, 21 years when he got the Nobel Prize. And I am familiar with his work because we all, with crystallographers, we all use the Bragg's equation. We all study it in our undergraduate courses. So here is John Jumper, pretty young, who got the Nobel Prize. The other person, and they got the Nobel Prize for protein structure prediction. The third person who got the Nobel Prize, David Baker, he got it not so much for structure prediction, but for protein structure design. His software, it can design proteins for you to perform some pharmaceutical job, or to provide some nanostructure, or to give you a sensor. So those sensors is just based on a protein molecule. Those will be smaller than what Shangram mentioned using bacteria. So those are the important contribution. David Baker, of course, he has been publishing for quite some time, and his H index, as I found out, was astounding 219 and 200,000 citations. So they are the average compared to our scientific career. Now, although the problem, we know the structure of proteins, but something is still missing. Like when you wrote paper, we mentioned that this paper is going to help in understanding protein folding problem. It was some sentence that we have to write, although we knew that our paper will not solve the protein folding problem. That protein folding problem, how the protein takes up that particular structure, is still not known, and that will take maybe years to solve. So that problem is still there. Now the protein structure, the first protein structure that was solved was myoglobin by John Kendrew. And then the PDB, as you saw in the last slide, it has got 200,000 structures now. But the protein sequence that is known is 200 million. So there is a huge gap between the structures we know and the sequence that we have, for which we didn't know structure at that stage. But now we all know the structure of all the sequences. So as you have seen, as you have heard, AlphaFold 2 is a neural network based algorithm. And the important thing here is, I think it was a quotation, if we have seen farther out, it is by standing on the shoulders of giant scientists. I think it was It is attributed to Newton, I think. And Janet Thornton, who was the director of EBI Cambridge, she said, we can see further not only by standing on shoulders of giants, but also on data. Whatever we are seeing through this software is all based on the accumulation of data and intelligent use of data. So, so after this was published, now they have got a database. Although PDB has accumulated all the structures solved by AlphaFold, EBI EMBL is also having a curated database, and the interesting thing is that database is connected to all other softwares and databases that EBI has. So you can seamlessly go from one database to another database, and it's very convenient to all the Indian, all scientists. And it is not true if you think that you have a very big computational lab and you will use AlphaFold to solve a protein structure. Is computationally very intensive, and with using some cluster machine will not give you any solution. So you have to rely on DeepMind. Microsoft has also started with something similar. So you have to depend on them for your for getting the structure. The good thing is DeepMind has made the code open source, and whatever structure has been predicted has been put into EBI EMBL data set, and anybody can access it. So that's a good thing. And maybe I may have a few more things, but because of shortage of time, I again don't know how I should. Maybe we follow this order. Yeah, okay.
So probably I am the most misfit among this panel because I am neither a structural biologist, definitely not a computational biologist. So I am primarily a cell biologist and a biochemist. So the way I'll tell my perspective of this, I'll say, amazing development in recent years with the development of artificial intelligence-based structure prediction. So for scientists like us, it's a very, very useful tool for a cell biologist like us, because currently I'll say we are working with a very new protein which is called epsilon tubulin. Of course, we have done a lot of cell biology, we have done genetic knockout, and we are trying to understand its function. But for us, trying to solve its structure was unthinkable. So now, at least using this tool, we can actually get the structure, try to analyze how this structure, we work, by the way, with a parasite protein. It's a Leishmania epsilon tubulin. We can do a little bit of analysis to see how this protein differs from its human counterpart or the counterparts in other organisms, which would not have been possible without this tool. At least it would not have been possible for a group like us who are not a structural biology group. So that is definitely a big advantage, that we can still, not being a specialist in the field, we can still we can still ask a lot of questions which are related to structural biologists. So having said that, I'll also try to point out a couple of limitations which I see as a cell biologist, because what I understand that this AlphaFold or AI generated structure are the structure of a protein, individual protein. But as we all know that within the cell, the proteins do not act individually, right? So the proteins are in an environment of thousands of other proteins. And many of these proteins interact among themselves to give rise to a functional outcome. So many of these proteins do not act on its own. So what I understood is that these tools, as of now, although probably they are trying to develop further, but as of now, they cannot predict the protein interaction, that how two protein or multiple, there are huge complexes of protein interact to give rise to a function. So that is still a limitation, and probably we have a long way to go where artificial intelligence can be used to solve or answer this kind of question. So that is one thing which I see as a limitation. The other thing which I think still is not well understood is that how, because you see, as a cell biologist and working in different diseases, we always have the dream to develop drugs, right? So how the molecules, small molecules interact with these proteins and can act like a drug, I think we are still not there when we talk about artificial intelligence based protein prediction. So I hope that in near future probably, and I'm sure that they are working towards this goal, and probably in near future will be benefited by addition of this new technology. So that is how I see this tool.
I'll just make one comment on protein complexes. They have a new release of AlphaFold. It's called AlphaFold Multimer that deals with protein-protein interaction. And in fact, we used it recently. They have put it in bioRxiv. And the latest version, which came up just last year, it is AlphaFold 3, which is better than AlphaFold 2 as far as the accuracy of individual protein structure is concerned. It does protein interaction. If you want to make an oligomer, you just give the protein sequence and say you want a trimer or a pentamer, whatever. It will give you the model. And it takes care of the ligand binding to protein molecule, at least the ligands which are available in PDB. So that is AlphaFold 3. It uses some diffusion, some algorithm, which apparently it doesn't consider a single structure, but a number of structures which can diffuse in and out, and ultimately you arrive at a structure which is much better than what AlphaFold 2 predicted. So things are moving even for protein small molecule interaction.
Yeah, Krishna Ramdo. Nice to be here. Well, we don't know where to stand and how to start, but maybe I can tell a little bit about there are 3 persons and the Nobel Prize was shared. So, where they differ? I think that we can talk about, because we have been talking about AlphaFold a lot, but we have actually, maybe it's not a bad idea to talk a little bit about David Pickard and how it differs from the other 2 persons. Right? So, DeepMind or Google Enterprise, what they did is so the idea of prediction of protein or how construction has been there for a long time. If I can tell you a little bit of story that might interest you. So I don't remember the year. I think IBM came up with a supercomputer and challenged Gary Kasparov for a chess game, and then that Gary Kasparov won very easily. It was just immediately after the human genome sequence was solved. So everybody was talking about proteomes and proteins. So Gary Kasparov won, just without any issue. I think the name of the computer was Blue DeepMind, Blue Gene, something like that. So they come up with a bluer version, somebody which is smarter than the blue one, and that beat Kasparov. So that revolutionized things. Everybody was talking, wow, who can actually compete with human mind and beat human body? And obviously, then there are other computers I think this is called AlphaFo, which beat this Chinese Go champion. There is always a competition between human versus machine. And the idea is, when we actually invented, chaka, wheel, that competition started. So can we have instruments? Can we have machine? Would that be a computer, or it could just be a mechanical tools which can compete with human ability and can it do better than human ability. And I think the process of AlphaFold or the predicting structure of a protein came kind of naturally. Now, where we are, I think, somewhere, so if you use ChatGPT, for example, so you use ChatGPT and write something, okay, write a prose on, how is Sister Nivedita University, it will give you something. Now, if you write the same thing yourself, you will see, you will actually know the difference between what ChatGPT wrote and what you wrote. And that's exactly where the difference between AlphaFold structure and a structure which is solved by maybe crystallography or NMR or cryo-EM blackbird. So it is there, but it's still not there. And you still have to do a lot of things. So that's half of the knowledge. The second half is how to design protein. Now, why it is important? So nature has been designing protein all along. So for example, suppose today we have a disease, nature will take care of it. Because we may have a disease because of some kind of pollution, maybe because we have been living 80 years, so some proteins are misbehaving because they don't know that we would be living 80 years. So nature would take care of it. That's called evolution, and it has been doing it. Except nature takes, I don't know, about maybe a few million years to take care. The question is, can we wait that many years? The answer is obviously not. So far, until today, it used to be the drug, small molecules and things like that. But now, David Baker, actually putting it from his talk, he said, why only drug and small molecules? Why can't we just design the protein so that we do better than the evolution? Or if it is not better than the evolution, faster than the evolution. That's your second question. And I'll stop.
Hello, I'm Amrajyoti from Bosch Institute. So while I was hearing them talking and telling us about their experiences and their understanding of AI in protein structure prediction, or how AI is actually influencing, I was thinking about my experience as well. So I can tell you a story. So by training, I'm a biochemist, and also I do genomics a little bit. So in our lab, we work on proteins that are involved in stress adaptation in microbes. So we work with small heat shock protein, different chaperone, so on and so forth, and also some toxin-antitoxin systems. Especially, we are particularly interested in archaea. So recently, we have a work where we characterize one of the novel toxin-antitoxin, which is a kind of a type 2 toxin-antitoxin system in archaea. And that system, here the toxin is basically an RNase molecule. In the cell normal physiological condition, what happens, the antitoxin, when it is present along with the toxin, they form a complex. And because of this complexation, the activity of the toxin is not really visible. Now, what happens under stress, the antitoxin is selectively removed from the complex, and then the toxin becomes available to the cell, and it targets the specific molecule that it targets, like RNA. In case of our system, it is mRNA and RNA. So we have been doing a lot of cell biology, genetics, and a lot of biochemistry to understand that. And recently we have published it. But at the same time, we were also trying to crystallize these two proteins after overexpression, purification, so on and so forth. And we were lucky, Pinagda knows, we actually solved crystal structure of the toxin at Bosch Institute with Professor Ajit Bikram Dotto. We solved it. And then for last 2 years, we have been trying to crystallize the antitoxin. But we were not successful. We were trying different things, different strategies we were adopting. We were not successful. Then 3 months back, I was sitting in the canteen with one of the other professors, Professor Shubhra Ghosh Dostida. We had Professor Ajit Bikram Dotto, who is a crystallographer. We three were sitting and we were having coffee, and we were talking about this. And then Shubhro goes to Siddhar. He suggested, why don't we try something different? Can we use AI, let's say AlphaFold, and also molecular dynamic simulation to do something? Can we help you in that? Then I said, okay, let's try. And then we started. And Shubhroda has a very bright PhD student who just completed PhD and now still working in the department, Devaroti. So she started using AlphaFold 2 initially, and then also this multi-mar analysis she did. And eventually we got some idea how the antitoxin maybe look like initially, and then how the antitoxin interacts with the toxin, how this complex formation is taking place, what is the mechanism. And also after that, what we did, we included the molecular dynamic simulation in that interaction. And then we identified the key residues that are involved possibly in the interaction. Not only in the interaction, this entire complex also can bind to their own promoter, which is an operon basically. They synthesize from one operon, bind to the promoter and controls the promoter activity or the polymerase activity. So we also identified residues that are possibly involved in such interactions as well. So this is a combination now. So only crystallization is sometimes very difficult for some proteins. And if you can combine it with other AI-based techniques like AlphaFold, nowadays it is giving a lot of information that we are getting, and also molecular dynamic simulation, where from you can get a lot of thermodynamic parameters as well. So that helps. I mean, it's a combination now. So if you can go multidisciplinary, if you can apply different types of techniques, then it may give you. So we are confirming let's say the identified residues by doing experiments right at the moment, both at the cellular level, also in vitro, and we are getting some results, some good results, let's say. And I'm really happy to see that when we are combining all these techniques, so AI can really assist you in going forward when you have no other choice, like structural information that is available in hand. And that's all. That's just an experience that I have, and I just shared with you. Thank you.
Hello, I'm Shuman Chakraborty from SNU-BioTalk National Center for Basic Sciences. So I'm a computational chemist by training who has been dabbling on biological systems. Now I'll take slightly maybe a different perspective. Of course, we have been talking about AlphaFold, it's great and so on. But as the title also includes AI and other computational tools. So I belong to that other computational tool also. So it's not just about AI, ML and AlphaFold. And also we have been talking about just structure. And I'd like to comment that biology is not just about structure. Much of the biological function involves dynamics, motion, and it's not just one structure. What is a structure really? So Nilanjana has very nicely pointed out several limitations of AlphaFold and AI-based prediction. So I'd like to just highlight a few points. Even when a protein is functioning, there are active states, inactive states. The same protein can exist in multiple structures. And AlphaFold will give you probably only one of them. But of course, there are variants of AlphaFold people are developing that if you give those sequence, this MSA data, you tweak with it, you can generate alternative structures. But then you don't know which is more stable, which is less stable. So there is no thermodynamic ranking to know that whether what would be the population of an ensemble of a protein structure. It's 80% this conformation, 20% other conformation. That is thermodynamics. So like Nilanjana talked about this free energy landscape view, there you need to know what is the population of these different conformational states. So to really understand function in some sense, we need to understand these different conformational states along with their population. So there comes thermodynamics, so not just structure. And then there is, on top of it, there is also the question of kinetics. What are the rates? Like when you talk about ligand, let's say a drug binding, unbinding, many a times the binding affinity can be same, but the kinetics like K on and K off can be different. So there are many problems in biology, that will, of course, I mean, AlphaFold is great and it's a fascinating tool, but I'm just also trying to highlight that depending on the problem or the question at hand, we may need to choose other computational tools as well, and they have their strength. Now, another couple of points. So Nilanjan again very nicely pointed out the difference between data-based tools like machine learning. Essentially, those are data-driven methods. And then there is this physics-based methods like molecular dynamics and other tools. But so the problem with the data-based methods is they're learning the rules from the data. So they're, of course, they're limited by the data. So if your data didn't see some phenomena, you don't learn those rules, right? And so then another new class is coming, which is physics-inspired machine learning, for example. So you can tell machine learning technique that there are certain rules of physics, like even physical chemistry, thermodynamics, you can add them as constraints. And then the learning in the AIML becomes better because they have some ideas that what rules to follow in some sense. So those giving physical constraints can make those AIML models better. And those are some directions some people are trying to take. So again, I'll just revisit that question that, again, for example, if your data set doesn't, even when it comes to, for example, IDPs, again, Nilanjana has pointed out, what is the structure of an IDP? You cannot really talk about even one structure of an IDP. It's about an ensemble, right? So you need to talk about an ensemble of structure. So it is not even enough to predict one structure when it comes to IDPs. Then it comes to the, again, condition. When IDP binds to something, it adopts a structure. So what is the structure of IDP? Depends on the context. So what are the condition, where it is? So all this information, for example, if you go take a protein to a different temperature, what would be its conformation? Can you ask AlphaFold, what will be the structure at that temperature? So of course we'll go there. But all I'm trying to say that for like understanding this context-dependent biology or when the environment changes, a lot of things actually changes in biology, and to understand them, as of now, you have to have those physics-inspired model on top of the machine learning models also. So these are the few points I think we should keep in mind. Yeah.
Anybody from audience has got anything to say? Yeah. Maybe Nilanjana has to respond because you have all the slides available.
So I am Dr. Nilabja Shikdar. So we have used AI and machine learning for the identification of biomarker in a gene level. So from the data, TCGA data sites, we have used the RNA-seq data and also the methylation data. And then both data we merged and then do the multiomics analysis. And then later we have used with this computational science and AI and machine learning model, nomogram and random forest model, we identified 2 or 3 sets of marker. That is a biomarker from that pancreatic. I am working on pancreatic cancer and gallbladder cancer in Indian population. So that's a good tools we have used for identification of biomarkers. And then we have to do the validation in the patient sample, but we didn't do that. But we use that tools to identify the biomarkers. Thank you.
Another application. Any other comment?
Okay, so I'm Sangram from SNP, and SNP is basically a physics institute. So if you look at the physicists, so AI is, I mean, biology is different, but nowadays all astrophysicists who are working on the particle physics and so on, all the data, even the CMS Alice in Geneva, the CERN, all data people are only analyzing with basically with the AI. So there is without AI, they cannot do probably. I think one understanding as a general public have that AI is something different, but all biologists, probably whoever in the students, they are also using learning, and that is one is called principal component analysis. So PCA. The PCA is nothing but a machine learning which actually reduce the dimensionality. If you go a little bit k-mean and so on. So it is nothing but a statistics we are doing for a long time. There's a meme, and it is showing there is a person, it's a Scooby-Doo kind of meme, and a person with a mask, written AI. If you took that, see it is statistics. So I cannot add many things, but it's an interesting question when I giving a talk to the students, it is school students, and students from the class 8 actually asked me a very interesting question. Can math, because I was showing this math equation and something, so she said that can math be an intelligent thing? So I think this is a very fundamental question, that a math cannot be as intelligent. I mean, math is completely different and it cannot be as intelligent. So the idea of the AI between the scientist and engineer is also different. So as a scientist, we know what we mean by the AI, because we don't think that is AI is like AlphaFold is, it is not thinking or it is not understanding. It is all of you actually mentioned, it doesn't understand how it falls. But if you talk to a computer scientist, the way they actually talks, they said it understands, it thinks, and so on. And they probably believe that is actually happening. So I think my question to the panelist is like that. So AlphaFold is fine, but is it not that people started thinking that we do not need crystallographer anymore? The AlphaFolds can do that. And it is a reality, or you think after 10 years we don't need a crystallographer, we can just do from just from the AlphaFold or any other programs we can do? So is there is a career option when students want to think what you want to do in his PhD? I mean, this is very important for the students, I also believe.
I think there are many other avenues, like there is I don't know the term, cell tomography. You slice the cells and do hologram, and then you can see how molecules are interacting in real time. So there's again structure, but not hardcore structure. So there are ways to diversify into other field, but crystallography, at least the EM crystallography will be there for a long time because of the large complexes. Even AlphaFold is not very good in predicting large nucleoprotein structure. I think is still not within its grasp to solve large protein complexes. So yeah, EM crystallography it will be there. Even small molecule crystallography, I think if Avrojyoti can crystallize his antitoxin, I think he will be happy to use that instead of using AlphaFold, because people will give more credit to that than AlphaFold. There is always some degree of doubt in what you do with AlphaFold. If I can say one experience of mine, my student, I don't do anything on AlphaFold. He used AlphaFold multimer to solve how a protein methyl transferase, isoaspartyl methyl transferase, it binds to tubulin. It started from tubulin, it is in equilibrium between tubulin and microtubule, and there are anti-cancer drugs like vinblastine that prevents it, the oligomerization. And he showed that PIMT binds exactly at the site where vinblastine binds. But again, we are having problem with the reviewer. In our publication, we gave one structure with tubulin with vinblastine bound, and another one tubulin with PIMT bound, and they subjected it to some software. It says there is internal duplication in your structure. It is intentional. We wanted to show that they bind in the same orientation. They subjected it to some software, and the paper, I don't know the status. So, but if it were crystallography, I think they will feel much more reserved in making such stray comments. Anyway, crystallography will be there. That's what I feel.
So I remember Gautanda saying this all the time. If you know PCA, you know how to deal with this kind of interactions. Long back, almost 10 years back. Now Gautanda is using AlphaFold. That's the funny part.
No, I think including crystallography and of course EM. I mean, and I think of the cream is NMR dynamics variables. So they can become so fast and so rapid, and so efficient. I mean, so earlier, what I think Nilanjan was talking about, like 10 years ago, one structure meaning one PhD. Now, who knows, 100 structure is possibly not even a PhD. So, I mean, so you can get a lot of structure much faster, and then those efficiencies actually making the AlphaFold better. And then AlphaFold also challenging a lot more crystallographer to do smarter science and things of that type. So this competition is going to go on for a long time. It depends only on, and then how a field is going to evolve or not evolve is very difficult to predict. I mean, I guess people knew that what would happen. But I mean, the structural biology, and particularly I think with the advent of this cryo-EM methods and the dynamics measurement, single molecule methods. So we are okay. I think we are pretty good. And I think AlphaFold will pretty much compete. But again, let's see what happens.
Hello, I am Dr. Debashish Majumdar. I belongs to Computer Science Department of Sister Nivedita University. And my work or interest on the other side, that is, I work on neural network. Now, as Dr. Chattopadhyay was telling, that Gary Kasparov very easily defeated the supercomputer designed by IBM. I start from that point. If you very closely look at the games played by Gary Kasparov and that supercomputer, in the first game, Gary Kasparov was defeated. There were 3 games. Then Gary discovered that during the training phase of that supercomputer, that algorithm, they used all the master games played by the previous grandmasters. Then Gary simply used the trick. He started giving unconventional moves, and that the supercomputer could not handle. What Dr. Shumon Chakraborty told, that machine learning is basically data-driven correct. Now, the question is, if you just go to Wikipedia, the contribution of Hinton, that is deep structured neural network, the first sentence Wiki write is that it is more bioplausible. What Wiki mean is that the other neural network before Hinton, they were not biologically very much aligned. Because the basic unit of computing in any neural network is the Minsky-Pippert neural network, which is simply an adder, and there is a threshold unit. If it crosses the threshold, then it fires. But the real action of neurons are much more complicated. For example, in the present neural network, there is no answer that in a real neuron, there is a refractory stage. That means after consuming huge amount of information, after some times, it does not receive any information. So in a network, when you are connecting a number of artificial neural networks, then that refractory concept is not there. Secondly, in real neural network, all neurons are not connected to all neurons. Selectively, in response to external signals in vision, on haptic, etc., the connection builds, which is called the receptive field technically. To some extent, in the deep neural network, the receptive field concept has been introduced. But interestingly, in receptive field, there are 2 zones. One is the positive firing zones. The other is the surround, that is suppressing zone, which suppress the activity of neural firing in the positive zones. That suppression zone has so far not been included in any neural structure. So there is a parallel growth taking place, that how it is possible to make the neural architecture more and more closer to the human brain activities. But unfortunately, all the human brain function is not still clear to us. So many feedback, so many feed-forward activities takes place. Everything, we could not reach into the deep of the brain level. Only some peripheral information are available with us. In, high level, in terms of artificial neural network, they categorize it as low-level processing, mid-level processing, high-level processing. For example, if I ask anybody what is this, he will call it micro. How? Because he will analyze the shape, the structure which he has learned from the childhood. But how they could attach the term microphone with it, which takes place in the high level cognitive processes, that is still unclear to us. There are many illusory signals in vision which cannot be explained by neural network, any neural network. People are trying, many. So David Marr raised this question long back, that all our sensory signals are processed are essentially algorithmic. Now people are working to find that how close it is possible to take the artificial neural network towards the brain activity. That is called the neurocomputing. And most interestingly, that will be my last sentence, Hinton himself in a paper wrote the deep structured neural network is working fantastic, but how it is working, that I don't know. In the inner layer, 75, 76 layers are there, hidden layers are there. In all layers, what is going on is really not known to at least the cognitive or computational intelligent people. That is the riddle.
Yeah, I think with this philosophical note, shall we conclude this session? And yeah.
Is it on now? Yeah. So I'll request the panelists to stay back on stage, and I also request Dr. Nilanjana Sengupta to come up on stage for your felicitation. I'll request moderator sir to felicitate the dignitaries. And also our convener, Dr. Amit Sarkar. To felicitate. Sir, Dr. Chakravarti, can you please felicitate them? The next. I'll request our conveners to felicitate Dr. Pinakpani Chakraborty. We now have the poster station just behind the curtain. So everybody can see the posters, attend the poster session, and then come back in due time for the next session, which is going to be a very interesting, thought-provoking session. We look forward to that after the poster session. Thank you. See you soon. The next session will start at 6 after the poster session. After the ISTEM session.